Yep. Is that what this is? The House Committee on Natural Resources, Environment, Tourism, and Outdoor Recreation will come to order. Would the clerk please take attendance?
Chair Pohutsky.
Here.
Representatives Hill. Here. Shannon.
Present.
Arbit. McFall.
Here.
Pies.
Present.
Martin.
Here.
Preston.
Here.
Shriver.
Here.
Madam Chair, you have a quorum.
Thank you very much. Vice Chair Hill moves to approve the minutes from our previous meeting on October 19th. Hearing no objection, the minutes are approved. First up, we are going to take testimony on a package of bills on water affordability from Representatives Ayash, McKinney, McFall, and Wilson. Only some folks are here. And also Senator Chang. I got so confused for a moment. You're fine. And we also have Senator Chang, who has a bill over in the Senate that is on the same topic. So if you all would like to begin, the floor is yours.
Thank you so much, Madam Chair and committee members, for this opportunity to testify on this package of bills concerning water affordability here in the Great Lakes State. Before we sort of get into the details, I just wanted to take a moment to remember several champions of water affordability that have passed away since the time that I first got involved in this effort. Representative Julie Plawecki, Mama Lila Cabell, and Detroit Council member Joanne Watson were passionate about water affordability, and we would not be here without their leadership. Water affordability has long been a statewide problem. Studies by MSU and U of M have pointed out that water bills have nearly doubled, in fact increased by 188% for the state over the past few decades, and water has continued to become more unaffordable for Michiganders. Many Michigan families continue to struggle financially long after the COVID pandemic, during which time we saw more than 317,000 Michigan households behind on their water bills. Every corner of this state, villages in the UP, suburbs in Macomb County, urban cities on the west side and in southeast Michigan, and everywhere in between, has people who are having trouble paying their water bills. And this legislature has acted several times in recent years in a bipartisan fashion to help people with water shutoffs. Access to clean, affordable water is important for our public health. Every human being needs access to water, and water coming out of your tap should not depend on how much money you have. Since I took office in 2015, water affordability has been a top priority after hearing the testimony from many residents in my district and across the state about the impact of shutoffs on their health, their mental health, and their family situation. This year, over the past 8 months, it has been an incredible honor to convene a water affordability work group and bring water providers and water advocates together to develop comprehensive, impactful, effective solutions for water affordability in Michigan. This work group includes representation from water advocates, water suppliers, both large and small, municipalities across the state, United Ways and community action agencies, environmental groups, and the Michigan Department of Health and Human Services. I think it's important to point out that this work group process, which I believe included more than 25 meetings, was collaborative and provided an opportunity for both advocates and providers to share about the needs of residents and solutions for affordability that can be realistically implemented. Over the course of many months, we delved into the specific details of how to make sure we create a water affordability program that makes Michigan a leader in the nation, helps thousands of Michiganders, and is implementable by our state and our providers. I'm very grateful for the partnership of colleagues both here in the House and the Senate on this important issue. We are the Great Lakes State, and water affordability must be addressed statewide to give every family a chance to make it in Michigan. So I'll give a very, very short overview of the bill package before giving it over to my colleagues to go over details. The first piece is the creation of a low-income water residential affordability program that ensures that low-income residents do not pay more than 2% or 3%, depending on which tier they're in, of their household income on water, forgives arrearages, and provides much-needed plumbing repair support. The bill also allows water providers to have their own water affordability program if they choose to, and we do have the Lifeline program and several others that you'll hear about today. The second piece is the funding mechanism that is modeled after the Michigan Energy Assistance Program, which was passed over a decade ago in a Republican legislature and signed by a Republican governor to generate funding for the affordability program. The third piece is a shutoff protection bill that protects people who have health conditions requiring access to water, creates multiple notice provisions to prevent shutoff, and develops an extensive triage program to help people to get help. The fourth piece is a tenant submetering bill that simply allows tenants to request the bill be in their name. And the last piece is decriminalization of water reconnection, moving it from a 5-year felony to a civil infraction unless a metering or backflow device was damaged. I want to point out that there is broad public support for these bills. Polling over the past 3 years shows support for the key components of the package: affordability, funding, and shutoff protections. Michiganders across the state and across political partisan lines support ensuring that every Michigander has access to water bills that they can afford. This water affordability legislation is comprehensive, it will be effective, has a broad support from a wide spectrum of Michiganders, and is the result of lengthy, thorough, collaborative work group process, and most importantly, will help thousands of Michiganders. Thank you.
All right. Thank you, Senator Chang. I think she did an excellent job summarizing the legislation. It's always a great opportunity to hang with Chang. I need to throw that in there this morning. So I before I pass it along to my counterparts in the House, I just want to sort of level set how incredibly important this is and how popular this legislation will be. We have an opportunity in Michigan to finally live by the credence of being the Great Lakes state and ensuring people have access to affordable drinking water. I want to be very clear for my colleagues who may question some of these intents. This is not a handout. This is an opportunity to be a leader in water and being incredible water stewards for our state. And I just want to show you guys where this falls in with the rest of Michiganders. So nearly 70% of Michiganders across our state support a water affordability program. And nearly 90% support shutoff protections, which is what my legislation would do. So in short, this is legislation that will literally be life-saving. I think we saw during COVID-19 what the opportunity to provide people water and keep their water on, how much that benefited Michiganders and how life-saving it was for so many people. And this package of bills will really make sure that as a state we keep a program like this and that it's going to have the funding necessary to make sure that it moves forward. So with that, I'm going to stay for questions. I think the ask is, Madam Chair, if it's okay with you, that we go through the presentations. We have a lot of impacted communities here to present, and then I'm happy to take questions along with my colleagues in the House.
Thank you, Madam Chair and members of the committee, for the opportunity to speak to the water affordability package alongside my colleagues. My name is Donovan McKinney. I proudly represent the 14th House District, which includes portions of Northeast Detroit, Warren, and the entire city of Centerline. I'm the sponsor of House Bill 5089, which creates a statewide low-income water affordability fund. The primary monetary source for this fund will be a $2 per meter monthly charge on water bills. And the fund will be allowed to take philanthropic donations. This fund, created by this legislation, is modeled after the Michigan Energy Assistance Program, also known as MEAP. That was created and put together through bipartisan legislation over a decade ago and signed by our former governor, Rick Snyder. What this fund would do, will MEAP, for which every electric utility customer pays a small monthly fee to ensure that low-income households can get help with their energy bills. I want to share a few of the reasons why the Low-Income Water Affordability Fund is needed. According to researchers at the University of Michigan, at the Graham Sustainability Institute, water affordability in Michigan across the state is an issue. The cost of water, even adjusted for inflation, has roughly doubled for the state as a whole since the 1980s. Continuing from the 2021 Water Affordability Assessment, I directly quote, "Small cities, suburbs, and rural areas follow that average," referring to the doubling of rates, while large urban areas, Detroit, Flint, etc., have seen such sharper rise. So while water costs have increased across the state, the issue is exacerbated in urban areas. This exacerbated situation in urban areas has caused folks in and around Detroit to lose their homes. due to water bills being too high and oftentimes behind and sometimes added to their property taxes, which increases that bill. It's been nearly a decade since Detroit was in the national news, with headlines from the United Nations condemning the city's human rights violations as a result of the city shutting off residents' water for non-payment. Further issues include during the Flint water crisis, folks received shutoffs and some paid their bills for water they couldn't drink because it was contaminated with lead. This heightened concentration of water being unaffordable in urban areas in Michigan is a problem, and providing support to low-income families across the state, and especially in urban areas, is paramount. I've said it before and I'll say it again, access to clean, affordable water is a basic human right. It's a matter of public health, safety, personal hygiene, and sanitation. Water affordability is about people living as human beings and having access to what they need, and we literally need water to live. As you hear from the rest of my colleagues today on the water affordability package, consider what these bills intend to do, and that's put our people and residents first. Thank you so much for your time.
Madam Chair, if I may, just go over the companion bill to Rep. McKinney's bill, House Bill 5088, which establishes the low-income water affordability program within MDHHS. And this makes sure that residents who can pay their water bills don't exceed 3% of their household income. So for households up to the 135% of the federal poverty level, their bill will be 2% of their average household income in the provider service area. And then for those who are in the 136% to 200% of the federal poverty level, their water bill would be up to 3% of the average household income in the area. Rep. McKinney's bill obviously explains how it would fund the legislation, and this is setting up a two-tiered system to make sure that we are trying to maximize and be as just as we can in terms of providing that assistance for folks. The bills will also provide flexibility so that a water provider can choose to continue or start their own water affordability program, such as Lifeline or RAP, or they can choose to opt into the state program through MDHHS, or it can be administered by community action agencies, United Ways, and others. Those enrolling in the program will be eligible for forgiveness of past due arrearages of up to $1,500 in the first year, $1,500 in the second year, and more if there's an extreme circumstance or need. And for households where bills are high because the water is leaking, they'll also be eligible for plumbing repairs of up to $2,500 per house. And this will help long-term to make sure that we are not wasting water, because that's oftentimes a huge problem when we think about the resources that we have. And if we're seeing that a lot of it's getting just leaked out and it's increasing the price of water for folks at home, it also is a bad idea because we're wasting that precious resource. So that is the first bill, which establishes the affordability plan that would use the affordability fund by Rep. McKinney. And then House Bill 5090 is the Water Shutoff Protection Act, and that protects households through clear guidelines and requirements for a water utility to carry out a water that they must do before a water shutoff for delinquent or non-payments. It creates a new category called the critical care customers for low-income persons with life-threatening illnesses or public health risks who are dependent on water for health treatment and care by medical providers. An example would be someone, for example, who needs an oxygen machine and requires water to actually generate that oxygen. It requires that before a utility would shut off someone's water for non-payment, that they would have to do multiple attempts to contact and communicate with the customer, and that includes phone calls, text messages, in-person notifications, and mailings. And it protects customers from shutoffs who attempt to enroll in a water affordability plan, who make minimum payments, and tenants who are not responsible for their landlord water bills. It also establishes a new triage process where enrolled customers who have difficulty paying their bills will meet with the program administrator to try to figure out what the barriers are and to receive additional help to try to remain compliant with the program requirements. So that's the summary of those first two bills. I'm now going to pass it to Representative McFall to talk about tenant submetering.
Thank you, Madam Chair, for having us today and colleagues. I'm Mike McFall. I represent House District 8. House District 8 represents part of Oakland County and part of Wayne County, which is Madison Heights, Hazel Park, part of Ferndale, Detroit, and Highland Park. My bill, which is House Bill 5091, would allow tenants to transfer their water and sewer bill into their name, making the tenant responsible for the bill. It allows for tenants to request that their water bill be transferred to the tenant's name from the landlord's name within 60 days if the dwelling is metered or submetered. After the bill is transferred to the tenant's name, the landlord would be required to stop charging any portion of the rent amount for water or sewer. This bill would not be retroactive and only apply to future rental agreements. This bill would also ban a landlord from discriminating or retaliating against a tenant that requests to have the bill transferred to their name. You'll hear more about why this bill and the rest of the bills in the package are necessary from the community members who have lived through this experience and more. But the key message here is that safe, clean water shouldn't be something that families need to decide if they can afford to live without. We continue to work with stakeholders on the details of this bill to make sure that it is amicable to everyone. So thank you.
Thank you all very much. Do any of the committee members have questions for the sponsors at this time? Preston?
Permission to just speak to the whole package?
You don't have to do that here.
All
You're
right.
good.
So I'm very familiar with MEEP and the LEAF programs. We use them in the utility industry for electrical shutoffs, and I agree with them in concept. But the one thing that I see in this bill package is that there's no point where the consumer has to jump off the program. This program allows somewhat permanence. The LEAF or MEEP programs, they approach the consumer in the most vulnerable times, which is during the winter, provide assistance to get them through that, and then there is an expectation of bills and bills being paid going forward. And what really concerns me about this, because there is no expectation of self-reliance, is that this becomes just another entitlement that is ultimately going to be borne by all of the ratepayers who are paying their bills in these jurisdictions. So I'm sympathetic to and I like what's going on. I just wish that there would be a time frame or a timeline in there where the consumer would be expected to fulfill their duties as a consumer of water.
Thank you. So I appreciate the question. I guess I would say a couple things. One, so it's partially modeled after MEEP, also recognizing that water is needed in all seasons, right? So we didn't add in a seasonal component like MEEP does. Also, I think I would really want to stress that the goal is to get folks into an affordability program where they are paying in. So you'll hear a little bit later on today from folks in Detroit and Oakland County. Detroit has a program where they have enrolled tens of thousands of folks into their Lifeline program where folks are paying. And so that's actually ultimately both better for the customer, right, because then they have their access to water. And it's also better for the provider as well because that's money that wouldn't otherwise be coming in. Also, I would say that two things. One, the triage process that is laid out in the shutoff protection bill is really designed to kind of, have that caseworker actually meet with this person face to face, find out what is going on in that person's life, because we all know if someone's behind on one bill, there may be other things going on as well. And so I know that our community action agencies across our state, we all have them in our districts, just does such incredible work, right, connecting folks to resources. So that is one thing to note, that if we can try to move towards getting folks the help that they need in whatever it might be related to their water situation. And then what was the other thing? There was a second thing that I was going to say, which is the plumbing. So a lot of our older cities, older homes, right, just old pipes. And we know, especially from sort of what's going on in Highland Park, but also across the whole state, that, when we have an older home, older pipes, leaky pipes, as Rep. Ayash mentioned, that if we could actually do that plumbing repair, it'll help reduce water loss, it'll help bring down the person's bill, and ultimately the goal is to move people towards more self-sufficiency. So, I agree with the goal of self-sufficiency, and I actually believe that our bills do that.
And just to add context, the senator mentioned Highland Park. So for every 3 gallons that the utility provider actually sends to the home, only 1 actually gets to the actual house. And it's because of the aging infrastructure. So you're looking at 2 gallons of water loss for every 3 gallons that we're sending out to people's homes. So there's a large issue there. And I think I just want to emphasize that Michigan is lucky to be around 21% of the world's fresh water and almost 80% of America's fresh water. That doesn't mean we get to turn the faucets on and never shut them off, but we have to recognize that the cost of water has nearly doubled since the 1980s, and in some communities like ours the senator and I represent, we're seeing up to a 320% increase in water. And the conversation that I think we also have to have as a state is when we talk about promoting and protecting the general good for the public, water is an essential need. It is not something that is a nice to have. It's not something that if you happen to have more money or you're someone who's able to constantly pay your bill in its full, that you should have access to cleaner water or more water. Water is an essential good, period.
No, and I'm not opposing that. My central point is I'm largely supportive of this. I'm just, somebody could theoretically pay the minimum payment. I don't even know how much that would be into perpetuity. The fact that there's not and you guys could pick what it was, but there's not a hard line break on this where the expectation of self-reliance is reinstilled. This is just going to end up growing, and I just see it down the road without some type of an endpoint being abused.
So I think the conversation from other folks today will maybe put a little more color to the conversation that you're bringing up now. But I just want to say one thing, right? This is not a handout, right? No one's getting free water. We are simply saying that if you live within the poverty threshold that I outlined between 135% or up to 135% or 136% to 200% of the federal poverty guidelines, that we are simply setting a cap of what your total income, what the total cost would be based on your income. And it's reasonable to suggest that if someone is living in poverty, I don't think they want to live in poverty forever. And it's doubtful that that them being able to get a discount on their water bill is going to be the reason why they want to live in poverty for the rest of their lives. I think there's clearly a motive if someone is living in the poverty threshold to get out of that and try to climb up the economic ladder. But if we force them to go into debt for paying something that is a literal human necessity, then we're not actually helping them get out of that cycle. So this legislation is actually an opportunity to give people a ramp to keep climbing up the economic ladder here in Michigan.
Thank you. We have a question from Representative Arbit.
Thank you, Madam Chair. Sorry. Thank you, you all for this important work. And I don't know who for, but I want to dig into a little bit. If someone could explain a little bit more about the critical care customer and sort of the role of that, because when I think of water, and as has been stated multiple times today, it's necessary for all of us. And so I'm wondering just a little bit more about the role of is it prioritizing those customers or how exactly that operates and the reasoning for it.
So this was a major topic of discussion in the work group that we can actually continue the conversation on. But so a couple things. The shutoff protection bill absolutely protects the critical care customers, but it also protects all other customers as well, in that if someone's applying for the low-income water residential affordability program or is on the program, then they will not be shut off. But when it comes to the critical care definition, we've done a lot of work on this definition, still very open, though, to suggestions, where we really felt that we need to sort of prioritize first those who have health conditions that require access to water. We did, through the process, add in folks who have a communicable disease, because just for public health reasons, obviously, we want to protect folks from, spreading whatever they may have. And we also are working on a sub with some tweaks to ensure that we are checking, like recertifying sort of what someone's condition is. But I hear you on, the overall goal of all this entire package is to ensure that folks have access to water. But we also recognize that to do an entire prohibition on shutoffs is not feasible at this time. So this is what we came up with through the work group process that we believe is the strongest and also the most implementable given sort of where we are.
Could I just have a follow-up real quick?
Sure.
Thank you, Senator Chang. And so when we talk about prioritizing, what does that actually mean in practice?
Okay. Sorry. Chime in. Okay. So for critical care customers, providers would not be allowed to shut them off.
Okay.
For those who are not critical care customers but are in the low-income residential affordability program, are in the program or in the process of applying to that program, they would also not be shut off. Okay. And then if someone is facing a shutoff, we build in, as Rep. Ayash mentioned, a minimum of 4 contacts, all with the goal of trying to get in contact with that person to try to get them in the affordability program, if cost is what's going on, if that's the issue. And then the fourth component is the triage process. And so Sylvia Orduña from People's Water Board can talk more about this because it came directly from her. But the process there is really to ensure that if someone is facing a shutoff, this person, we can't figure out what's going on, to actually have a meeting with this person and find out what's happening with this person, and how can we get them in. And we have great caseworkers at our community action agencies who I think are going to be so integral in this process to making it all work. And you'll hear from a couple community action agencies later on as well.
So is that the mechanism for how an individual would be able to, know that they can qualify as a critical care customer through the caseworker programs?
Well, but potentially. So I used an example earlier. If you're someone, like I have a brother at home that requires oxygen, and you have to fill that up with water in order to actually generate the oxygen flow for the machine. If someone is dependent on that for their living, right, that would be a definition of critical care. Because if your water gets shut off, then you can no longer actually utilize the machine that allows you to do that. If you're someone that needs a humidifier for a reason, humidifiers are used with water. So those are, if you're someone who's susceptible to bed sores and things of that nature, those are all components where shutting off your water would not be conducive to that person's general health, and it would actually be destructive in the long run. But broadly speaking, what the legislation is intended to do, it's not trying to keep everyone's water on in perpetuity without having payment, right? That's not the goal. The goal is, prior to water being shut off, did we do our due diligence to make sure they paid? Are there people that are just forgetting to pay their bills? Possibly, right? We have situations in my district where there's a senior that is forgetting that they have a water bill that they have to pay. Now, should that person get their water shut off after 3 months or 2 months of non-payment? No. So the goal is to try to communicate. Let's say we give them a call. Well, this senior citizen maybe doesn't remember to answer their phone calls. Okay, fine. We're going to send them a flyer or a letter. Well, they're not checking their mail. We see their mailboxes being stuffed. So then at one point we say, we're going to reach out to this individual and say, hey, you haven't paid your water bill. And if it's a matter of, I can't afford it, we would say, well, there's programs available for you to try to get on a payment plan or figure it out. And if there's situations where there's an extreme circumstance, that's where we would do the triage program as well. So the intent is to actually get people to pay their water bills. It's just shutting off water can be a very expensive process for the provider. It's actually, sometimes it costs more to turn the water on and off than to actually get the person on a payment plan and say, look, maybe you were down on your luck for 3 months, but if you get on a payment plan for 6 and you pay it off, we'll keep your water on, and that's okay. That's more cost effective for the utility and for the municipality than actually shutting the water off. So this is actually the most economical way to address the concern of lack of water payment across the state.
Minority Vice Chair Martin.
Thank you, Madam Chair. I'm going to wait for the entire, I got some more questions in my head. But I just want to address something that Representative Ayash said. So you said the rates have gone up 320%. So when I was a city councilman, we had to put a water treatment system in because we have our own wells and the arsenic level changed. But that was 2009. My water rates haven't changed. The Caledonia Water System Authority came into Genesee County when I was a Genesee County Commissioner. 7 consecutive years they have not had a raise in water rates. So are we addressing the right problem here by paying somebody's bill or getting the water rates down and addressing the way we produce water?
So there's a couple things there, right? We think when we pay a water bill, we're looking at exclusively the costs of the actual water. And we say, oh, you could buy a case of Nestle for like $3 at Sam's Club. Why is it that it's so much when we're getting it at our home? Oh, you brought up a good point. Half of that, or a huge chunk of that, is actually the infrastructure that actually delivers the water to our homes. The reality is we have a lot of communities with aging infrastructure, particularly the places that have more established communities for long periods of time. So you look at communities in the UP or communities in Metro Detroit or communities in Southeast Michigan that have had residents that have lived there in large quantities for over 100 years, 150 years. The infrastructure that's actually there is very, very old. I just purchased a house, and that house has lead service lines in it, right? It's a very, very old material and old technology that is used to actually deliver water to and from the house. So the conversation around addressing water in infrastructure, 100%, I actually would look forward to working with you, Rep. Martin, on figuring out how we can actually get that across the finish line. But that doesn't mean in that process that people should be losing access to water, which is a critical need. So what we can try to do in this moment is, as we're looking at making us require that we are looking into the reasons for why someone's not paying their water bill or why they can't pay their water bill, perhaps we begin to learn that it's very expensive. I use the Highland Park example. So I'm paying for 3 gallons of water, let's say a certain charge per 3 gallons of water, but I'm only getting 1 gallon of that water to actually use. So now I'm paying triple what I actually am using, because the water that's getting delivered to my house is not getting there in its entirety, but I'm being charged for that full amount of water that's getting to my house, right? So that allows us to look at that conversation and say, okay, or look at that situation and then have the conversation of what can we do to help mitigate that water loss? What can we do to help mitigate the water waste? And what can we do to figure out ways to ensure that we are putting people on track and communities on track to be able to address those needs? And it's simply not the problem of they're not paying it, so we turn it off. That's not solving the problem either.
I'll just also add, and thank you, and actually I would love to learn would love to actually have a conversation with the water folks in which city? Okay, very good. And we do have some folks here from the American Water Works Association who will be speaking, so definitely would love to have a follow-up conversation, but also they may be able to help answer that question as well.
I was just going to point out, we have some folks from the city of Detroit and from Oakland County that can answer infrastructure questions. So if you have an infrastructure question, please save it for them. We are on a time crunch, and after the sponsors are done with their piece, we are actually going to take the votes on the previous bills that we've heard previously and then come back to testimony for the sake of not trying to cut other people off. So Rep. Pies, do you have a question that is best suited for the sponsors?
Yes. Thank you, Madam Chair. I have a monthly coffee hour with seniors, and some of them read recently that they are going to be charged $2 extra on their monthly bill, and they're upset because that's $24 a year that they could be putting towards something else. So I'm wondering if you could clarify how this is being done so that I can relay this information to them at the next coffee hour. Thank you.
So what's going on is similar to, and I explained it earlier, similar to MEEP. This is going to be a $2 water per meter increase. It's going to raise us about, I believe, $65-70 million a year. The problem with water in general, water rearages, people who are literally getting in trouble, right now we have water assistance programs out there for folks that are it's really reactionary instead of being proactive. We're trying to capture and help people before they get behind on their bills. Because if you look at what's going on, people can lose their homes as well from unpaid water bills. It really taxes onto your property taxes. And so we're trying to protect people, but we all need to be in this thing together. Because we try to solve the issues with utilities, with our energy side of things. Now we're trying to do the same thing with water, because water is essentially a human right. Like everybody needs water. The planet can't even survive without water. But that $2 per meter raise, it's a small chunk that we actually need to, do for everybody. But I will say this: we're also looking at other funding mechanisms to come into play. That we're having discussions with stakeholders and things of that nature to come in and try to help supplement the cost. Because we all know that the $2 per meter raise isn't going to solve all of the issues with water affordability. But it's something that it's a shared sacrifice, so to speak, and we need to really all come together. I compare it to something, and now I'm not sure my colleague wants to talk about it, but I compare it to transportation. I don't know if anybody knows in the 1970s, Michigan, Southeast Michigan in particular, had the opportunity, got some federal funds to build a mass transit system. Detroit ended up keeping its portion of the money. At the time, it was cheaper to build above ground than below. That's how we ended up with the Detroit People Mover, a 2-mile or 3-mile loop around downtown Detroit. But Macomb and Oakland County sent their portions back to the federal government. And guess what the federal government did? They reappropriated those dollars to Washington, D.C. And D.C. is now enjoying a metro system that literally could have been built here 50 years ago. And it's one of Michigan's Achilles heels is not having a mass transit system. We're one of the only, I think, metro areas in the entire nation that we can't even get from our airport to the city. So I'm saying this, and we're losing population for it, and our governor has set up a population commission. I'm saying we do not want to make the same mistake with water. We need to make sure that people have access to clean, affordable water. And me being on appropriations, we put our Democrat, literally our legislature, with our governor's support, we put so much money, $600 million, in water infrastructure, improving sewage, improving sewer lines, and doing things in terms of
Rep, I'm not trying to cut you
Oh,
off,
I'm
but
sorry.
we got
I could go on and on.
through.
I go on and on. But all I'm saying is it's a shared sacrifice, and we got to get outside the mentality that each of our individual communities can't come together. We got to stop working in our own silos. We are one region. We are one Michigan. We are one state. We need to help those less fortunate.
Rep Ash, if you want to have 30 seconds to answer this question.
Thank you,
That's-
Madam
I'm
Chair.
timing you.
Rep Paez, so if we don't allow people to figure out how to pay this bill, what happens is this becomes a bad debt expense, and the water utilities just put it on everyone's bills in the future. So it actually makes sense that we allow people who are low income to pay into their water bills rather than having them just have it as debt that we end up paying for at the end of the day anyway, because whatever is not paid gets transferred right back to all of us, including those seniors, in the form of an increased water rate across the board. 45 seconds.
Close enough. Rep Schreiber.
I think I might be able to swing my question and make it apply to a different batch of people for the sake of time.
Thank you. I appreciate that. Rep Hill.
All I want to say is that as a city commissioner in Marquette, next to the largest body of water in North America, we increased our water rate 60%. 60% in the time I was there, which was 4.5 years. Now, granted, that's because we had to move the water uphill. Hey, lakes are down. Our city's up here. So all our water has to be moved uphill, but it is the infrastructure question. And yes, I pay more for my water bill in the summer months than I do my heating bill, and it's not that warm in Marquette either. So yes, these infrastructure questions are really important, and as you have very well explained, the debt is being paid by all of us, and it is not fair to put these people in this position. Let's follow a program that works. Thank you.
Thank you very much. Okay, so we are going to move back to old business for a second so that we don't have to keep going back and forth and cutting folks off. First up, we are going to take a motion to report Senate Bill 441. I do know that we have some amendments being offered. Rep. Martin, do you want to speak to your amendment? I know we all have it, so if you don't want to, that's okay too.
It's straightforward, so we don't need to go through it.
Okay, very much. Thank you very much. Then, Madam Clerk, will you please take the roll on adopting the amendment?
Motion to amend, Chair Putsky.
No.
Representatives Hill.
No.
Shannon.
No.
Arbit.
No.
McFall.
No.
Pies.
No.
Martin.
Yes.
Preston.
Yes.
Shriver.
Yes.
Madam Chair, you have 3 yeas, 6 nays, 0 pass. The Martin amendment is not adopted.
Thank you very much. Rep. Preston, I know you also have an amendment. Do you want to speak to yours?
Thank you. Just to the fact that there's a couple of bills that are in the works right now in regards to commercial fishing, and would just love to see everything work together.
Thank you very much. Madam Clerk, will you please take the roll on the Preston amendment?
Motion to pass the amendment, Chair Putsky.
No.
Representatives Hill.
No.
Shannon.
No.
Arbit.
No.
McFall.
No.
Pies.
No.
Martin.
Yes.
Preston.
Yes.
Shriver.
Yes.
Madam Chair, you have 3 yeas, 6 nays, 0 pass. The Preston amendment is not adopted.
Thank you very much. Next up, I'm going to take a motion to report Senate Bill 441 with recommendation. Motion made by Representative McFall. Madam Clerk, please call the vote.
On the motion to report, Chair Putsky.
Yes.
Representatives Hill.
Yes.
Shannon.
Yes.
Arbit.
Pass.
McFall.
Yes.
Pies.
Yes.
Martin.
Pass.
Preston.
Pass.
Shriver.
No.
Madam Chair, you have 5 yeas, 1 nay, 3 pass. Senate Bill 441 is reported with recommendation.
Thank you very much. And I am sorry, we already knew this, but we did have a card in support but not wishing to speak is Tyler Ritterbusch from the DNR on SB 441. Next up, we are going to take votes on House Bills 4824 through 4826, which we heard testimony on October 19th. We do have a couple of cards to read in. Not wishing to speak in supporting the bills, Emily Smith from the Michigan Environmental Council. Not wishing to speak and opposing the bills, Amanda Fish from NFIB. Thank you very much. I will take a motion to report HB 4824 with recommendation. Vice Chair Hill makes the motion. Madam Clerk, please call the vote.
On the motion to report, Chair Putsky.
Yes.
Representatives Hill.
Yes.
Shannon.
Yes.
Arbit.
Yes.
McFall.
Yes.
Pies.
Yes.
Martin.
No.
Preston.
No.
Shriver.
No.
Madam Chair, you have 6 yeas, 3 nays, 0 pass. House Bill 4824 is reported with recommendation.
Thank you, Madam Clerk. I will take a motion to report HB 4825 with recommendation. Motion made by Rep. Arbit. Madam Clerk, please call the vote.
On the motion to report, Chair Putsky.
Yes.
Representatives Hill.
Yes.
Shannon.
Yes.
Arbit.
Yes.
McFall.
Yes.
Pies.
Yes.
Martin.
No.
Preston.
No.
Shriver.
No.
Madam Chair, you have 6 yeas, 3 nays, 0 pass. House Bill 4825 is reported with recommendation.
Thank you very much. I will now take a motion to report HB 4826 with recommendation. Motion made by Rep. Shannon. Madam Clerk, please call the vote.
On the motion to report, Chair Putsky.
Yes.
Representatives Hill.
Yes.
Shannon.
Yes.
Arbit.
Yes.
McFall.
Yes.
Pies.
Yes.
Martin.
No.
Preston.
No.
Shriver.
No.
Madam Chair, you have 6 yeas, 3 nays, 0 pass. House Bill 4826 is reported with recommendation.
Thank you very much. All right, thank you all for letting us take care of that before we continued. So now we are going to have testimony from a variety of people, which is why we need the bigger room today. If everyone can keep their testimony to about 3 minutes, we do have some hard stops today, and there's obviously a lot of really important testimony to hear. So first up, I am going to bring up Sylvia Orduño from the People's Water Board, who is wishing to speak in support of the bill. Cindy, are you coming up with her as well? No, I can wait. You can if you want to. Okay. And then Cindy Roper from the Natural Resources Defense Council is coming up with Sylvia as well, also in support. So the floor is yours. Sylvia, I'm really sorry. Can you hit the red button in front of you?
Yes. Should I start over? We're good? All right. This is the time we've been long looking forward to. This is truly a grassroots effort, and for anyone who has been doubtful about whether or not democracy can still exist in the age in which we live, and whether or not residents will actually try to get involved in the legislative process, I can tell you that that's really what this effort has been. I have been working on water affordability at the community level since 1997. Started in the city of Highland Park, moved into Detroit, where we started learning the devastating impacts when residents don't have safe, clean, affordable water and sanitation. We have to keep thinking about both parts, both ends of that. What I've seen over the years is something that it stays with you forever. Devastating circumstances when people have been living, and things that we've all come to learn, but sadly have become normalized. And I think the conversation that you all were having today was very much about wanting to change the ways in which residents, utilities, and communities are working together. It's been a difficult way to really try to figure out how we can move past different opinions on how it is that people should pay their bills, or how it is that utilities are charging for utilities, when ultimately we want to make sure that people have the water and sanitation they need for household health and public health. The pandemic was a lot of ways a lesson for all of us, and what we're trying to also make sure that we're doing better today. But there's still many obstacles, I think, politically, that we're hoping that you all will help us be able to move away from. What we're asking for here is a way to ensure that all households across the state have water that they can afford based on their ability to pay. This is no longer a Southeast Michigan problem as it's been portrayed for so many years. And I think, again, what we've learned is that residents across the state, especially in some counties where voices are less vocal and where some leaders are less willing to acknowledge the problem, have been stifled. We want to ensure that now everyone across the state can have safe, clean, affordable water as they need. I've been doing this as a community organizer for more than 26 years now. And I'm more recently working on this as a coalition director, where we've got over 36 grassroots organizations, environmental groups, faith-based organizations, social justice people that have been working for this same purpose about establishing water affordability across the state. We believe that the package that is before you is the best that we've been able to work on for many years. Every year for the past 8 years, we've been coming here and working with several members of the Senate and the House to get bills reintroduced, but this is the first time we've ever had a chance with a hearing, because we've also now got the utilities to come to the point of recognizing how it is that we've got to work together. They have not been able to squeeze that blood out of a turnip, right? If people don't have the money to pay, and they recognize that unless they can make this actually a part of their business operations to be able to collect what people can pay, that they're never going to be able to get out of that cycle of shutoffs that cost people money and other residents higher debt that they've got to pay in the form of rate increases. There are lots of questions you all are raising around infrastructure and rates that we're not going to be able to address at this time, and that's not what this package of bills is about. This is about ensuring that we're putting cost controls for low-income residents to be able to pay them what they can afford, and there's lots of other pieces that other folks are going to address, but I appreciate your time today.
Thank you very much. Cindy?
Thank you so much. My name is Cindy Roper. I'm a senior policy advocate with the Natural Resources Defense Council, and I have submitted written testimony, so I won't go through the details of my work on drinking water and on other water issues, but I've been working on these issues for decades. Through that period of time, I was mostly focused on safe drinking water and on clean water going back into our natural systems and into our drinking water sources. It has only been over the past decade in working with the People's Water Board Coalition and with its partner groups on affordability that I have really become more involved in understanding. Like, it's not enough to just have safe drinking water, you also have to be able to afford it, because what good is if it's safe and you can't drink and you can't keep your water on. So in 2020, for the first time, it's kind of been mentioned here, but the legislature approved a $25 million appropriation through a supplemental appropriation, and it's referenced in my testimony, Public Act 123 of 2020. And with that money, for the first time ever, we were able to find out what was happening, at least in the communities that applied for that money. And as I noted, there are roughly 1,400 community water systems in the state of Michigan. Only 144 of those water systems applied for the funding from the program. And then, as detailed in the back of my testimony, I provided what is an updated chart. We had a chart before that listed all the districts, and with everything changing, the new maps, I haven't updated that. But basically, it shows that this problem is a statewide problem, even with the sampling of water systems that applied for that funding. And you can see in the spreadsheet at the back how many of the water systems, basically what we found is that 317,000 households in Michigan from just that 144 water systems, representing approximately 800,000 Michigan residents, were behind on their water bills. And of those, only about 37% were eligible for the funding that was included in that $25 million. So a large number of the people who were behind on their bills were not eligible, but with that, all of the money was used. And I want to make one last point this morning, and that is that this bill that I'm describing from 2020 was an assistance program. It was an effort to throw money at a problem to try to help people at that time get caught up on their water bills. And what you have before you in this package is an actual affordability package that attempts to establish rates that residents can afford and to get them on, as it was noted previously, on a plan where they're able to contribute to paying for the water. So just really want to emphasize that we are strongly supportive of these bills. They will be landmark bills in the country if Michigan can get these enacted and we can start helping people keep their water on. So thank you so much.
Thank you very much. Are there any questions for either Cindy or Sylvia? All right, thank you both very much. I appreciate it. Next up, we are going to hear from Willie Brake, who is an impacted person here to speak in support of the bills.
Good morning. Can you hear me?
Yes, sir, we can. The floor is yours.
Okay. My name is Willie Brake, and I'm a Detroit resident and a single dad of a teenager, and I'm a member of the Michigan Welfare Rights Organization. Although I'm a college graduate, I am also a person with a disability who has worked with state agencies to help me train for employment opportunities and earn a living. However, these things have not prevented me from being someone who can afford my household water bill. Economic problems and family circumstances have put me in a situation where I have not been able to afford my water bill. As a result, I have lived without water and have had to flush my toilet and bathe using bottled water. It was a terrible experience that is hard to imagine unless you've had to do it for many days yourself. I'm also a renter and a participant in the HHS program, where I've had to make sure that my water and energy bills are paid so I don't get in trouble. I work hard and have helped my child be successful in school, but oftentimes not enough as we struggle to get by. In the past, I've participated in assistance programs that put me on a low payment plan that I could afford, but then after 12 to 24 months, I got time limited and was told that I couldn't be in the program anymore. It really didn't make sense to me because I was able to pay my bills and keep up with the payment. And just as I was getting stabilized and able to manage all of my bills, I was kicked out. I believe we need a statewide affordability plan like the one you have here before you that lets residents like me stay enrolled as long as we are eligible and in need. This will help us be able to have healthy homes for our families and allow us to go to work and school safely and successfully. You probably don't hear from a lot of men like me about the need for water affordability, but it's important for us too. So thank you for your time, and I strongly encourage all of you on the committee to support the water affordability plan championed by Senator Chang and members of this committee. Thank you.
Thank you very much, Mr. Brake, and thank you for sharing that. I know how, I actually have had my water shut off before, and I know how difficult it is and how vulnerable it is to talk about what that reality is like. So thank you for sharing. Does anyone have any questions for Mr. Brake right now? Okay, thank you very much. Next up, we are going to hear from Mary Sheffield. I believe she is in here. And I know she has to leave earlier, so I wanted to make sure we bring her up. Where is she?
Good morning.
The floor is yours.
Thank you to this honorable committee. Council President Mary Sheffield, have the honor of representing the Detroit City Council and to be here to testify. I do want to start off by mentioning that the entire Detroit City Council just 2 weeks ago unanimously approved a resolution in favor of these packages of bills, and so we are in full support of what is being proposed today. I also would like to thank our Senator Stephanie Chang for the invitation to speak today and for having the courage to sponsor this important piece of legislation. Under continuing distressed local economic conditions and in the absence of an income-based water affordability plan for low-income residents, the result has been the inability for many residents throughout Detroit and also the state of Michigan to pay the full charges for water and sewage services. In Detroit alone, this was leading to mass water shutoffs at one point, affecting up to 3,000 families per week and over 30,000 residents annually, impacting residents living in poverty, people of color, persons with disabilities, single parents with children, and elders living on fixed incomes. For the last several years since I've been on council, I have personally tried to play a leading role to address the issue by calling for moratoriums on shutoffs and drafting a local income-based water affordability ordinance to protect the people in our city. Water is a human right, and depriving residents of access to clean, safe drinking water is inhumane and a serious threat to public health. During the pandemic, we all learned the valuable lesson that our lives, especially our health, is inextricably tied together, not just locally, not just regionally, not just nationally, but globally. In the absence of an income-based water affordability legislation, a dedicated statutory funding stream, the lives of Michiganders all over our state, and especially in Detroit, hang in the balance. Without an income-based water affordability plan and funding, we are all at a greater risk of spread of communicable diseases and potentially more pandemics like COVID-19. Without an income-based water affordability plan and funding, families are at risk of becoming homeless and having children taken from their homes where the water has been shut off. Without an income-based water affordability plan and funding, some of our most vulnerable citizens, like our homebound seniors, the disabled, those suffering from chronic and terminal illnesses such as diabetes, asthma, and cancer, are left out and are more vulnerable. In Detroit, and I imagine all over the state, we will be watching, we will be waiting for the passage of these bills so that we can introduce local income-based water affordability legislation that can be funded by your efforts and help to ensure that no Detroiter or Michigander is forced to survive without access to clean, safe drinking water. In closing, I am here to express my unequivocal support as the City Council President in Detroit for this critical water affordability legislation, which is right for Detroit, it is right for Michigan, and it is right for humanity by protecting public health, securing revenue for water providers, and covering low-income households across the state. I'll just leave you all with a quote, and that is, the measure of any society can be found in how it treats its most vulnerable members. Thank you all for the privilege to testify.
Thank you, Council Member. Does anyone have any questions for Council President Sheffield? Thank you very much for making the time. Next up, we are going to hear from Deborah Taylor and Monica Lewis-Patrick with We the People of Detroit. Thank you all for being here. The floor is yours. If you can just make sure that you hit the red button before you speak.
Madam Chair, it was our understanding after speaking with your office, it would be best for the three of us to jointly present.
Wonderful. Thank you very much.
Yes, ma'am. Thank you.
Good morning, Madam Chair, and thank you for this committee allowing us to speak. My name is Cecily McClellan, and I am proudly call myself a lifelong Detroiter. I stand here with two other colleagues of We the People of Detroit. Each of us will speak briefly on here today. I'm not here just as a resident, but also as a former employee of the City of Detroit Department of Human Services. And I worked closely with the Detroit Water and Sewage Department in developing the Detroit Residential Water and Sewage Program. For the past 10 years, I've served as the director of the Director of Waterworks Program for We the People of Detroit, a role that requires emergency relief of water, delivering water to homes. It is devastating families living without clean, safe, and drinking water. It is disheartening to see water hoses snaking between households and homes for neighbors trying to ensure that everyone can have access to water. Have you ever had to explain to someone how to repeatedly use water for basic needs before they finally expel that water through their toilet flushing? It is a stark reminder of the hardship people face. My colleague Deborah will also give firsthand experience on the indignities of families.
Good morning. Thank you, Cecily. I helped found We the People of Detroit after years of working in philanthropy because it's unacceptable that we still have community members in many parts of Michigan, across the country, who live without clean, safe, and affordable water. Though I come to you today as a Detroit resident, I also stand as a daughter of Flint, Michigan, where my parents raised me and taught me the value of civic engagement and power that comes from the community when we raise our voices together. What many people don't know is that the water crisis in Flint was quietly understood by many residents for years, and it took a massive push, the enlisting of hundreds of community members, and the attention of national reporters to get enough momentum to do a single thing about it. After years of running our water crisis hotline at We the People of Detroit, I can sadly assure you that there are hundreds, even thousands of people with stories they've yet to tell about the devastating consequences of losing water in their homes. We the People of Detroit was born from a chorus of community voices that would not stand for second-class citizenship, nor would we quietly accept the trauma and devastating health consequences that come when we deny people the basic resource of safe, clean, affordable water and sanitation. The proposal you're considering can help some of these people, but I have seen the devastating impact of water shutoffs up close, and I must urge you to make an important change to ensure that those who are at most risk of losing their water are not left behind. And We the People of Detroit's President and CEO, Monica Lewis Patrick, will tell you more about the changes this bill needs to include. Thank you.
Thank you, Deborah and Cecily. Thank you, Madam Chair, and to the committee. Over the years, countless water assistance programs throughout Michigan have come and gone. I have seen firsthand that assistance is not and will never be a long-term solution for households facing chronic poverty. I believe the package of bills that Senator Chang is proposing is a great step in the right direction towards water affordability. I'm impressed by some aspects of the bill, but I believe the program can be strengthened to ensure our most vulnerable residents don't fall through the cracks. First, we must decouple the funding for the program. In doing so, we protect residents from the burden of increased water bills that they cannot afford. Second, it is critical to implement shutoff protections to protect vulnerable residents like children, the elderly, and the disabled. Third, expand those protections for existing tenants who fall below 200 of the poverty federal guidelines. And finally, we must establish a process for forgiving past debts and water arrearages. Without this, we are essentially setting up residents with existing debt to fail. I would urge the committee to approve the aforementioned amendments. It is time to advance past Band-Aid solutions and ensure that we keep water flowing for all residents of the Great Lakes State with a true low-income water affordability program. Thank you for your time and consideration. We would be happy to answer any questions you have, Madam Chair.
Thank you very much. Are there any questions at this time? Thank you all very much.
Thank you.
Next up, we are going to hear from Rosalind Walker. who is an impacted resident who came to discuss her experience. Thank you very much. Great. If you can just push the red button, and then the floor is yours. Thank you so much.
How you doing today, Representative Hoopsky and the Natural Resource Committee? My name is Rosalind Walker, and I'm a Detroit resident who have lived for more than 7 years on the east side of Detroit in District 4. I am also a mother and a grandmother who at times could not afford my water bill and live without water. I am also a renter who being required by my landlord to pay a water bill that is not in my name. In fact, the water bill that comes to my house is in someone else's name, a person I don't know, and my landlord has required me to pay it or risk eviction. Last month, I was able to enroll in the Detroit Water and Sewage Department Lifeline program when I learned I could get the water bill in my name and get affordable payment without my landlord's interference. I want other residents, including family and friends that live in other counties, to be able to do this too. People like me are struggling to pay water bills, sewage, and stormwater drainage bills that we cannot afford. I know this firsthand because I have been working for the last 2 months with a team of People Water Board volunteers to talk to residents about their water bills. We have reached out to over 120 people door to door at grocery stores, at dollar stores, and at schools while parents wait for their kids. Actually, I started doing door to door outreach in 2018, even during the pandemic. What I'm hearing from people is that they are afraid. 78% of them are renters, and 68% of them say they are responsible for a water bill that the landlord is supposed to pay. They don't want other people to know they sometimes don't have water, especially their landlords or child protective service. 63% of people said their biggest water worry is that they can't afford to pay the monthly bill. And 41% of them also told us that they are not aware of water programs that can help. Low-income residents in this state need the water affordability program, regardless of where they live. We have fought for many years for the basic human rights, and we want to pay bills we can't afford. None of us are asking for free water. I ask you to support the water affordability bill package because it will make a huge difference in my life and that of other families for long-term water affordability and protection to keep us safe, healthy, and allow us to work and go to school without worries and be clean and don't smell. Thank you so much.
Thank you, Rosalind. And I appreciate you bringing up the CPS aspect of that as well, because that's a very important note. We want children to be safe and healthy, and we also want them to be at home, and they can't do that if
We
they don't
also
have water.
have people that's on subsidized living, and they
Exactly.
can't get their water turned off.
Exactly. Does anyone have any questions for Rosalind? Thank you so much for being here. I appreciate it. Just so everyone, including committee members, is aware, we do have to break when session begins. We're not allowed to continue committee when session starts, but we're not having session today. So we will go at ease briefly, let them finish things up, and then they will give us leave to meet again. So just so everyone is aware. And that has to happen right around noon. So we're going to have time for a few more people before then. And I also know that there are some members that have to leave, and I believe we've had those conversations. But if we don't, we can have those conversations while we're at ease. Next up, we are going to hear from Louis Pisker from the Wayne Metro Community Action Association, or Agency, I'm sorry, who is here in support of the bills.
Hi, good morning.
It was on, and then you turned. Yeah, I know. I'm sorry. I feel like that's all I'm saying today.
I'm hitting the red button. Good morning. Good morning. I'm Louis Pisker. I am the CEO of Wayne Metropolitan Community Action Agency. Thanks for having me here. We are the Community Action Agency, not only for all of Wayne County, but also the city of Detroit. Wayne Metro participated in Stephanie Chang's work group with a lot of the advocates and officials that are sitting here today. A unique place Wayne Metro has is we are the service provider for a lot of the programs and how these bills would be implemented. Currently, Wayne Metro is the service provider for the City of Detroit's Lifeline program, and we are also the service provider for the RAT program, the Water Residential Assistance Program. In the Lifeline program, the need is great in the City of Detroit. In less than a year, and I'm sure Director Brown will comment on this data. We've enrolled over 26,000 city residents in the Lifeline program, with a vast majority of those residents being at the lower paid tier of $18 a month. The program has been a tremendous success. Also, we continue to see high volumes in the City of Detroit and in outer Wayne County for the RAT program. We continually get about 1,500 applications per month for water assistance. I think the bills can really have a significant impact based upon our experience in administering these programs. I think there's 3 components that are like key to the bill. The first one is the income requirements. It goes 0 to 200% of poverty. So it's not only low income, but it goes up to moderate income families and individuals also, which covers that really important ALICE population. Second, it does provide arrearage forgiveness, which helps keep people on the plan. And most importantly, in our experience since dealing with the water crisis since the pandemic, if you do not have a plumbing repair program that is in combination with an affordability program, the program I do not believe will be successful in the long term. These bills do have a plumbing repair component, which I believe is extremely, extremely important to keeping water bills low, helping with infrastructure and water costs by the authorities, and making the program affordable for everyone. We also administer the MEEP program in Wayne County. I believe we're the largest provider of MEEP services. There is no comparable water assistance program to MEEP. I don't think that's equitable. I do believe there needs to be a funded water affordability program that is equal to what the other utilities receive via MEEP. The shutoff protections, the transfer the bills into tenants' lane, the decriminalization of water are all really, really important aspects to the bill that get clients to come to us and ask us for help and keeps them in the program. And we're also able to provide those wraparound services when people do get into trouble. So overall, based upon the need, based upon the content of the bills, based upon our experience and actually doing the hard work with people on a daily basis, these bills are definitely the way to go. They're definitely the way to go. And so based upon the need, I strongly urge all of you and all the leadership here in Lansing to pass these bills and pass this legislation. Thank you.
Thank you, Louis. Does anyone have any questions for Louis? All right. Thank you very much.
Thank you.
Next up, testifying via Zoom is Michelle LaJoy, who is the Executive Director of Community Action for the Algier Marquette area, and she is testifying in support. Michelle, the floor is yours.
Thank you. Good morning. I hope you can hear me clear.
We can. Thank you.
Okay, thank you. Again, my name is Michelle LaJoy. I'm the Executive Director at Community Action Algier Marquette, also known as CAM. CAM serves Algier Marquette counties in the Upper Peninsula, and we partner with 5 other community action agencies to serve the 15 counties of the Upper Peninsula. Along with our 26 sister agencies across Michigan, CAM works with the local community to fight the war on poverty. Through partnerships at the federal, state, and local levels, CAM marshals over $8.4 million in public and private resources to improve the economic and well-being of individuals and families in our area. CAM works with an average of 2,500 clients a year. We are not simply a service provider. CAM works deeply and directly with our clients to help them achieve economic and social independence. Because of this deep relationship with our clients and your constituents, our agency knows firsthand the face of poverty and the diversity of those who experience it. From working mothers, fathers, to elderly on a fixed income, poverty in rural Michigan is diverse, dynamic, and growing. Our clients need access to utility assistance for different reasons. Whether it is a sudden on-the-job injury, loss of employment, or health issues, the emergencies people face is different, but the need is still the same. Our aging population is also continuously squeezed by the rising cost of living statewide and stagnant Social Security and retirement benefits. The federal government's LIWAP program meaningfully challenged this status quo during the last 2 years, with LIWAP benefits easing the burden on poor Michiganders across the UP. With the program's sunset and ongoing dysfunction in Washington, it is clear that Michiganders need a long-term solution for water affordability. An elderly disabled veteran who did not have water for several months after shutoff due to a large unpaid bill. Unfortunately, with the local water providers billing, consumers still accrue charges even when the water is shut off. His bill was over $700. We were able to pay off the past due balance, getting his water back on and giving him a fresh start. An elderly woman taking care of her daughter and 3 grandkids. One of her grandchildren recently fell off a 40-foot rock face that was less than 2 miles from her home. Not having to worry about a shutoff gave her more time to be there for her family during this long and difficult recovery. House Bills 5088 through 5093 would make a significant progress in this front and aid community actions fight against poverty. This legislation has my full support. While I continue to talk about this legislation's potential positive impact, I will leave that to the others. There are 2 areas for improvement I'd like to direct the committee's attention to. These are specifically important to rural Michiganders. First, the requirements of the appointed representation included in the task force this legislation creates should be expanded. The legislation does well to include representatives from varying constituencies, including small, medium, and large water providers. It should also be mandated to include representatives from counties of varying sizes too. Small water providers in large counties will have a different concept of water affordability issues than the smaller providers from smaller counties. Because of this, I ask that counties with populations smaller than 15,000 and between 15,000 and 50,000 be included in some form as part of the mandated representation requirements. Second, like LIWAP, this proposed water affordability program has a glaring blind spot for rural residents. Just like Michiganders who have water and sewer service via a utility, rural well and septic users experience poverty too. Oftentimes, rural well and septic users are more vulnerable than their counterparts. They trend older and more likely to live on a fixed income. Any number of circumstances can lead to these individuals living with failing water infrastructure. This legislation is smart to allow for the Water Affordability Fund to be used for plumbing repairs. This legislation should be explicit and ensure that those plumbing repair dollars may also be used for households with well and septic systems. Just a small amount of money dedicated to the repairs for these households would make a huge difference in the fight against poverty in Michigan's Upper Peninsula. I cannot stress enough the importance of the water affordability measures proposed in this legislation. Passage of this legislation with modest changes would be more inclusive of rural communities, will be a major step forward in Michigan's fight on poverty. Please let me know if you have any questions, and thank you for allowing me to testify before you.
Does anyone have any questions for Michelle right now? All right, thank you very much for the time, Michelle. At this time, folks, we are going to go at ease and wait for session to give us the go-ahead to resume. So the committee will stand at ease to call the chair. Committee will come to order. Thank you all for your patience. Next up, testifying in opposition, we have Brad Ward from the Realtors. I believe. I texted him letting him know, so he may be on his way up. Then instead, testifying in opposition to House Bill 5091, we have Kathy Lombardo from the Property Management Association of Michigan. I think. Just kidding.
No, I'm here.
Oh, never mind. She's virtual. Thank you so much, Kathy. Sorry for the confusion. Kathy, the floor is yours.
Can you hear me?
Yes, we can.
That's great. Okay, well, thank you for letting me testify today. My name is Kathy Lombardo. I'm the president of Lombardo Property Management and also a member of the Property Management Association of Michigan, which is, as you probably know, a group of professional property managers representing over 200,000 units in the state of Michigan. So I've been in this business for over 24 years. Our company owns and manages 8 communities in 5 municipalities, representing about 1,500 apartment homes. They are all sub-metered. So I'm speaking specifically to the House Bill 5091. I was asked to read it and provide my opinions on it. So I did that yesterday. And I just want to say that I'm in total support of the access and affordability to clean water. Fully believe in that. I just don't think that parts of this bill 5091 is the best tool to help get us there. Just to give a quick overview of how we process sub-meter bills, we get the bills all from the city or township, sends it to accounting. We code them, we put the unit number on there. We put that in their ledger so they get the exact bill of what they've used. And then we send it with the rent statement to them every month. Now, when they receive the bill, if they want to know what the detail is behind it, they just call our property manager and they send them a copy of the exact bill that we receive from the city. So if that happens, they're taken care of. So really section 1A on that is already something that most professional property managers, companies that are sub-metered already do. So when they pay their bill too, every month, the first dollar or first $100, whatever it is, goes to water before it goes to rent. So they can be assured the way we do it now is that their water is paid for first. And if they can't pay their water or part of their rent, we always work with them to get their payments up to date with a payment plan and help them find rental assistance when needed. So the way it works too right now works for us really well because we can see if they're getting behind. We can be an advocate for them. And ultimately, the water is in the owner's name, the landlord's name. So no matter what, I'm paying the bill. I'm never shutting off water to the residents. And 99% of the management companies and landlords in the state would never shut off water to a tenant. We just wouldn't do it. I'm paying the bills. If I don't pay the bills, it's in my name or the company's name, then it gets put as a lien on our property. And then we get tax liens and we have to pay fines and we could lose our property if we don't notice that we have these water bills on there. So from a landlord's perspective, it doesn't work that great, even in terms of us helping the residents. Now, so I also want to say, like, operationally too, the townships and the cities do not have the manpower or capabilities to manage the billing and actual reads to put the water, and they all act differently. So to be putting the water in a tenant's name, they just don't have that. You know, tenants move out. We have 12-month leases, and our residents move out. You know, we get 50% move outs every year. They would have to like manage the whole putting it into the tenant's name and out of the tenant's name hundreds and hundreds of more times, thousands of more times in some cities, and they just don't have the manpower to do that. And I actually called Ron Marini from Washington Township Department of Public Works, and he said they tried that 20 years ago, and then actually it was one of our communities, and had to abandon it as it was way too much of a burden on the billing department. And so it's not practical, and especially because of the turnover in the apartment communities.
Kathy,
So from their perspective, I guess I would say talk to some of the townships and see what they see. And my last point on this one is that one half of our communities that we're in, over one half of the communities, bill water quarterly and not monthly. So we average out the water and we kind of almost do a payment plan with the residents, because we're not going to give them a 3-month bill. We're giving them a 1-month bill. And so in that respect, they're getting a $60 monthly bill instead of a $200 quarterly bill, which may be harder for them to absorb in their budget.
Thank you, Kathy. I appreciate that. I did have one question, and I'm not trying to spring anything on you. I'm trying to interact or figure out how these interact or would interact, or if at all. So I'm looking up a statute that we've had for quite some time, apparently, about municipal water liens. And it sounds like there is already the possibility for tenants and landlords, if they agree in a lease, for the water bill to be in the tenant's name. So if that's the case, if that's already a possibility, can you discuss how 5091 is a broader concern, if that's already a possibility in the state?
Well, I didn't know about the other ones, so I really can't say. I was just really talking about this bill. In our leases, we put that they will be billed for their actual water use. So I guess I was assuming that this was something new that would be implemented.
But if it's not, does that change anything? Because I'm looking over this, and it sounds like there's, it's not like copy and paste, obviously, but it does sound like that provision already exists. It just has to be in the lease. So I understand it's not for your folks, but if it's already possible, and it is potentially already happening with other rental properties,
How is it? I'm sorry, I'm going to ask a question to your question. How is it different than 5091? And
there are other aspects in 5091 about just outlining like the actual, like what the landlord would have to do. And again, this was required in a lease ahead of time. So there is a change there. But my understanding is your point was, if this is allowed, it would be an encumbrance. And my point is it is already allowed, just there has to be it has to be part of the lease agreement first. So there's a shift in when it would be permissible, but it is already allowed in the state.
Okay. Yeah, and I use the National Apartment Association lease that is updated by our attorneys in Michigan. So I would have to refer to that, but I know within our lease we choose to do it this way. So
okay.
I can't answer your exact question right
Okay,
now.
no, I appreciate it. Thank you. Thank you for at least going down that road with me. Are there other questions for Kathy at this point in time? Rep. McFall?
I don't have so much of a question as but to add to that. So I do understand your concern. That is my portion of the bill package. I have been in contact with Brad from the Realtors, and I also know that Senator Chang has as well. And so we are still having discussions around that. So just so you know, there are still discussions happening on that with stakeholders. So.
Okay, great. And if you have any questions, I'd be happy to be a sounding board if you'd like to contact me.
I appreciate that. Thank you.
Thank you.
Thank you very much, Kathy.
For your time, everybody.
Thank you. Brad did text back. He is not going to be available to testify in person, but he does have a card of opposition that we are entering into the record. Next up, we are going to hear from Bonifer Ballard from the Michigan section of American Waterworks Association in support of the bill package.
Red button. I'm teachable. Good afternoon. My name is Bonifer Ballard. I'm the Executive Director of the American Waterworks Association Michigan section. We thank you, Chair, members of the committee, for taking up this important issue. Our members include municipalities, water systems of all sizes, engineers, manufacturers, suppliers, academics, all from the water sector. We have about 2,200 members across the state. The American Waterworks Association has 55,000 members across the world. and our sole purpose is to help our members effectively manage water. In the winter of 2020, MIAWWA, our organization here in Michigan, completed a strategic planning process where funding and finance was actually identified as a strategic issue for water here in Michigan. As the pandemic took hold, it quickly became apparent that water, and specifically water affordability, was a key component of that strategic issue. Over the last 3 years, we sought a better understanding of various aspects of water affordability. We brought in experts from areas such as utility rate setting, financing options for water utilities, social service and social justice organizations, not anything we'd ever done before, and academicians to help our members understand and our leaders understand really all the big factors that were impacting water affordability. We also were invited to a dialogue with perhaps previously unlikely partners that we might not have reached out to in the past about collecting data around the cost of water across our state. During that 3-year period, we also worked with representatives, I think Representative Martin, on SRF, State Revolving Fund. That is a key component in helping water utilities operate. Then in early 2023, we were invited to participate in a stakeholder group convened by State Senator Stephanie Chang on potential water affordability legislation, and that's what brings us here today. I want to take just a moment to thank Senator Chang for such an inclusive and thoughtful process. These stakeholder meetings brought together a plurality of voices from multiple perspectives, and throughout this process, water utilities concerns were heard and actually seriously considered. I have come before you today to share MIAWWA's broad support of these bills. Although there is language that still needs to be further reviewed and clarified in several of the bills, MIAWWA believes that these bills generally represent what's best for both water utilities and water customers in Michigan. We continue to work with Senator Chang's stakeholders group on specific language changes to make the best possible program for Michiganders and Michigan's water utilities. The past federal investments in infrastructure of the 70s and 80s ended. Water rates have often been the sole source for keeping utilities running. We as an organization realize that the cost of infrastructure is rising, and there are times in which customers simply are unable to cover the cost, the true cost of water. This is why we are supportive of these bills. They ultimately will address a utility's ability to maintain infrastructure and continue to deliver clean, safe water. MIAWWA respectfully encourages this committee to support the package of bills on water affordability, and we look forward to continuing dialogue as they make their way through the legislative process. Our organization is available to answer any specific questions you have about these bills and how they might impact water systems across the state, and we will help support the committee as you deliberate on this important issue.
Thank you very much. We do have a question from Minority Vice Chair Martin.
Thank you, Madam Chair. I do have a question that you might be able to answer or lead towards or find out something. So potentially $3 a water meter could be charged to our residents. Is there a pie chart or breakdown that shows how much of that $3, where it all goes to? Water production, infrastructure, administration, potential pension and OPEB even? You know, where is this money that they would, for each dollar they spend, where does it go?
Some of the bill language does allocate specific percentages. I think some of those details are still being worked out, and there are probably people better than me to describe that for you.
Do we have further questions from the committee members? Thank you very much, Jennifer. I appreciate it.
Madam Chair.
Next up, we are going to hear from Sean McBroody from Clean Water Action, and then Christy McGilvray and Irma Leapart, who is joining us virtually, I believe, from the Sierra Club. If you guys could all come up at once, that would be ideal. Thank you all very much. The floor is yours.
Thank you very much, Chair Pahutsky and committee members, for allowing me to testify today on this water affordability bill package. I'm Sean McBroody. I'm the Michigan Director for Clean Water Action, and we represent over 130,000 Michigan residents who understand that access to safe, clean, and affordable drinking water is a human right. I'd also like to thank the House bill sponsors who were here earlier today, as well as Senator Chang, for Senator Chang's tremendous leadership in developing the bill package before you in what you've heard from others already is a very open, transparent process that really brought along all the stakeholders involved here throughout several months. So I wanted to start with some historical background. Over the last 40 years, water rates in Michigan have nearly doubled when adjusted for inflation, and in some Michigan communities, water rates have as much as quadrupled over the same time period. According to current estimates, today 1 in 10 Michigan families struggle with unaffordable water bills. It hasn't always been this way, and over the last 40 years, the problem has continued to grow more dire. The current funding model that water utilities rely on relies on scant federal funds that are supplemented by state and local matching funds while the balance is carried by ratepayers, and the balance carried by ratepayers is not sustainable and was never designed to be sustainable. For example, in 1977, the federal government contributed an average of 63% of the necessary funding for water infrastructure to each state. In recent years, the federal government has contributed less than 10% of the water infrastructure needs. Because of federal disinvestment and then later state disinvestment, the burden for paying to maintain our aging water infrastructure has to a greater and greater extent fallen on residents and ratepayers. Again, that's not the way the ratepayer system that water utilities operate under was ever designed to function. This is largely why Michigan ratepayers have seen water rates double in the last 40 years. As urban sprawl accelerated in the 1960s through the 1980s, increasing needs for water infrastructure stressed the systems of our urban cores. And this helps to explain why in certain communities they've seen their rates as much as quadruple in the last 40 years. In many urban core communities, ratepayers are paying for infrastructure that transports water to faraway suburban communities. The current ratepayer system that we rely on was never made to sustain so much of the necessary investment in water infrastructure. And that's the core of the reason that 10% of Michigan families currently suffer from unaffordable water rates. These bills would create a statewide water affordability program, allow local water utilities to implement their own program as long as it meets the same minimum standards as the state program, and ensure that residents across our state have reasonable water bills that they can afford to pay. Moreover, this package will provide protection against water shutoffs for residents who qualify for the program. This will guarantee water rate transparency and decriminalize the act of turning one's water back on after it's been shut off. As we all know, Michigan is surrounded by 20% of the world's fresh water. We understand the importance of this resource, but what does it say about us as a state right now that even with the abundance of water that surrounds us, 1 in 10 families can't afford the water that's coming from their taps? Water is a human right. It's not a commodity to be bought and sold, and it's not a luxury for those fortunate enough to be able to afford it. The bills before you today are a huge step towards recognizing that all people, regardless of income, have a right to safe, clean, and affordable drinking water. So I strongly urge you all to support and pass this package. Thanks very much. I'll hand it over to Christy and Irma.
Thanks, Sean. I really hope that all the members of the committee take a minute to read our official Sierra Club testimony. I am going to beg for your patience and take a moment to break from decorum and address you with my personal thoughts on what has happened here. Because the work that Senator Chang and Sylvia Orduño and Gary Brown and everyone else you're hearing testify today, the work they've done has humbled me. I am in absolute awe of what has been accomplished because there was an open, transparent, democratic process that involved good faith negotiations in which people that have previously been publicly at each other's throats have come to consensus. I am not overstating things when I say that Senator Chang's work has renewed my faith in democracy. So I really encourage you to read my testimony. It goes into municipal debt financing and why that's a really bad idea. But I really want you to know that backstory. So I will turn it over to Irma, who, for example, in the past, I've worried about what she's going to say because sometimes we disagree. We don't on this one. Go ahead, Irma.
Thank you, Christy, and thank you for this the privilege of being able to provide testimony today. I agree with Christy that these bills are, and the effort, really the process that it took to come to this point has really it's been phenomenal, and it is the way government should work. And so, thank you so much for this initiative, for doing this, and for putting people first, right? Ultimately, this is about, are we helping people? Are people's lives going to be improved by these pieces of legislation? And the answer to that is yes. And I don't want, I hate being the one that says it, but no, they may not be perfect, but they're awesome still. It doesn't take away from the really excellent work that is being done. And again, the fact that people's lives will be improved. And when we think about each other as humans, as our neighbors and friends and relatives, I mean, that's who we're talking about. And so, I don't want to go back to my neighbors and friends and relatives and say that I did not support something that I know for a fact would make their lives improve and have a better quality of life. So thank you to all of the efforts, the initiatives. I've been working on this for a while with the People's Water Board. So we've come to a good place, and thank you so much.
I'm going to add one finer point to what you said, Irma. These bills, the position that Sierra Club has taken is not one of best case scenario given certain uncomfortable circumstances. What's happened is that stakeholders have been able to come to consensus, change opinions, and put forward a truly supportable, fantastic package of legislation that sets up a structure that will allow us in the long term to fix our water infrastructure funding issues. We can support these with absolute no reservations, and I really encourage everyone to celebrate their success.
Thank you. Other questions for anyone? Thank you all very much. Next up, we are going to hear from Melissa Mays from What Are You Fighting For? Sorry, it's been a long day. She is testifying virtually. Melissa, the floor is yours.
Thank you. I apologize. I am traveling, working on environmental justice, but I run What Are You Fighting For since January of 2015, and I'm operations manager at Flint Rising and a directly impacted Flint resident, mother of 3. So I'm also, I do social work in the city of Flint and Genesee County. And I just want to point out that today is day number 3,471 since Flint has had clean, safe, and affordable water. And the affordability goes back even further than that. But I wanted to share with you, since this tends to be a political issue and it should be a human issue, I want to share a couple of stories from just the past week. This is Diane. It says, "Hello, my name is Diane." She's asking for help. "I am 76 years old and I fell and broke my back in my new home about 10 months ago. This is after being homeless for 6 weeks. They turned my water off on Friday. I have not been able to clean my wounds on my body or take care of myself properly. I am retired from the County Board of Commissioners, and she even worked for the water department at some point in time. And she said, I don't understand why my water was turned off on Friday. There's nobody I can get a hold of. What am I supposed to do?" Now, if anybody's interested, she sent me photos of herself trying to clean herself with a bucket of bottled water. I want to talk about Michelle and Brian, who over the 2 winters ago, they had their water shut off and they were told that they had to pay. They were both on disability. And they were told that they had to pay $1,500 to get their water turned back on. They don't have that money because they are on Social Security and a fixed income. And so they end up melting snow to flush their toilet and to wash their hands and to bathe. Obviously, we haven't had a lot of snow constantly recently, but this is 2 disabled folks out there melting snow to flush their toilet and wash their hands. Also, Nathan. His father is fully disabled and he was living alone, and he has been living without water for 2 years. And he is severely disabled. He lives on $780 a month for his part of disability. He's back on. So we had to go fight. Now, sorry if my internet's unstable. That's that. I, with all my jobs and all the work, just had to pay $550 to prevent my water from being shut off. Again, I live in Flint, where we pay some of the highest rates in the United States, but I had a water leak inside my walls, and we had to take down my kitchen and then one of my bathrooms to the studs. So I am stretched thin with this, and there's no assistance for me because I do work, but also my water bills are far above the 3%. And also, if you look at the, and just responding to some of the messages earlier or the comments earlier about this being, a handout or a way to keep people in poverty. The way to keep people in poverty and needing help is to allow these rates to continue to bankrupt folks, to allow them, like myself, to choose, do I make my car payment, my mortgage? Do I buy food, medication, or do I pay for my water? Because in Flint, that we are at about over 60% renters, there were 16,000 homeowners who lost their homes because they had a tax lien put on from unpaid water bills. And I also want to add in that the more people that get shut off, the more water that sits stagnant. And in Flint, and with all of the privatization and everything going back and forth, regionalization systems, one fact remains true. The fewer users, the more, especially in large outdated systems, the longer the water sits stagnant, the worse the water quality gets for everybody. So in making sure that people are getting shut off just because they can't afford their water and they can't afford to, the basic human right that, again, should not be political, it's a human right, you're impacting the water quality of everybody else.
Thank you, Melissa.
Also, then you look at the health and everything else. So
Melissa, I'm sorry, I don't want to cut you off, but we are short on time, and I wanted to see if anyone had any questions.
Yes.
All right. Thank you very much, Melissa. I appreciate you taking the time to speak with us and for sharing your story. Next up, also testifying virtually, we have Nayira Sharif from Flint Rising.
Hello, everyone. Once again, thank you so much for holding this hearing. And this is the culmination of many years of work from water advocates across the state. And I feel like this process, even though I haven't necessarily been participating in the work group, is a model of how co-governance can work and how people can put their minds together to craft policies that are in the interest of residents who desperately need it. Once again, I'm Nayira Sharif. I'm director of Flint Rising. And you heard a lot of people, talking about how water is a human right. And actually December of this year is the 75th anniversary for the Universal Declaration of Human Rights. And this policy, and I'm hoping that this bill package will be voted out of committee. And so the full House can be able to vote on these bills, is a critical moment for how do we see ourselves and how are we taking care of our residents. I lived through the Flint water crisis, and even though, lead was the issue that really kind of pierced the media bubble and made it international news, there was a water affordability crisis as well, where people have lost their homes to tax liens through unpaid water bills, and people were losing their homes and going through the tax foreclosure process for water bills for $1,000. And the fact that it's a public health issue, that people can be catapulted to homelessness and child protective services, that is something that when we think about how we are taking care of someone, we cannot have these regressive type of policies. And I would just like to close out that, I have my own ideas of what could be amendments to this that I will reach out directly. But even though like my somewhat uncertainty from supporting, because I were people of different expertise and different ideas, you know, wrestled with how are we implementing this? How do we make this a fit that isn't going to be a flash in the pan? And how are we making the material conditions of Michigan residents better through the passage of this bill package? And thank you for your time.
Thank you very much. Are there any questions at this time? Thank you so much. Next up, testifying in person. If you two wouldn't mind coming up together, I would appreciate it. If we could bring up Gary Brown, who is the director of Detroit Water and Sewage Department, and Jim Nash, who is the Oakland County Water Resources Commissioner. They're both testifying in support, and I feel like they can answer some of the infrastructure questions that we may have had. The floor is yours. Thank you very much.
Thank you very much, Madam Chair and honorable representatives. I'm really honored to be a part of this process. A bunch of the folks that have spoken today, we've been working through this in the whole 3 years my office has been doing this. By the way, I've given you my written testimony. If you're interested, if you have any questions, please reach out to me. I've been the Oakland County Water Resource Commissioner for over a decade. And we have 350 employees. We do work all over the county on drains, which is what most drain commissioners, water resource commissioners do. But we do way more than that. We operate and maintain for 22 communities in Oakland County, so we're very familiar about how water systems are paid for, how the rates are, and how it affects the citizens. I've met a significant number of citizens in my town halls when I've talked to folks individually that have been affected by this. And they're just people like everybody else. When I was young, I know it's a long time ago, I had very low income, and we had significant issues paying bills. And I can tell you that once you get down that rabbit hole, the bills pile up, they get more, you pay some, but it doesn't enough, so that things actually you can end up paying, but have more in the arrearages over time. So this has a dramatic effect on individuals, but it also has a significant effect on the systems that they depend on for their water and sewer. We've talked a lot about water, and the not having access to water can cause significant issues for especially elderly folks and young children around dehydration, around not having what they need to survive. But it also has a significant impact on elderly folks who are on a fixed income that just can't afford to pay more. And I've heard that from the Representative Paez. And I think we have to recognize that it's had an effect on the individuals, but also on the system in general. If we're not paying the true cost of service, we fall behind. So many communities this has happened to. Just in Oakland County, we operate the 22 communities we operate is 175,000 people. That's a significant part of our population. We have very small communities of less than 1,000 ratepayers, and very large communities, 20,000, that have significant issues with paying their bills. When that happens, the actual system itself, if you're carrying from one year to the next $9, $10 million in debt, that's $9 or $10 million you can't do the work that needs to be done. That next year those rates have to go up. If we have a system where we have $2 for every metered account, not just per meter, some people have 2 meters. So if we have that, that's going to have an impact on the long-term viability of that system. If we're not paying for the true cost of service, the costs accumulate over time, and we end up in this significant problem. All the things that we do, we deliver clean water, we take away sewage. If you're in a house without sewage and water, waterborne diseases can be much more prevalent. You can take them out of your own home and go, if you work in a place, you could take it to fellow workers, you could take it to customers. All those things, when you're interacting with people, that's something that can spread through the whole community. Those are the kind of things that we're doing. This is not the fault of the customers. They almost always really want to pay their bill. They just have a hard time doing it, and they fall farther behind without that. Our systems, are paid for by the ratepayers. It was mentioned a little while ago that used to be the federal government had a huge role in playing infrastructure, underwater infrastructure, water infrastructure, and now it doesn't. It's new just in the past year or so. We've seen significant amount new availability of grants and forgivable loans, unfortunately, a significant number of communities can't even come up with that matching fund to get those. So Oakland County, we're working on that, but in a lot of communities across this whole state, it's a significant problem. I'm here with one of my managers and the chief legal officer who's been running this this program for a little over 3 years. We've been operating on this for my county. And Kelsey wanted to talk just briefly about what is existing and how it interacts and how we can use this to better that system.
If I may, Chair. Thank you. I just wanted to mention that Oakland County does have a program right now that helps income-eligible customers pay their water bill. That's the Water Residential Assistance Program, WRAP. It's also available in Wayne County, Macomb County, and the city of Flint. This program considers each household's income as well as the amount of their water bill to provide them with a bill that they can afford to pay. As Commissioner Nash said, our customers do want to pay. Sometimes they just can't pay the full bill. The issue with this current program is it has enough funding to last most customers for 2 years. So once a customer takes advantage of the WRAP program for 2 years, they're no longer eligible for it. So the bill package that you have in front of you would provide a sustainability aspect to something that's already really working in Oakland County, Wayne County, Macomb County, and Flint. Thank you.
Good afternoon. My name is Gary Brown, and I'm the director of the Detroit Water and Sewer Department. I'm speaking to you today as one of the many water utility leaders in the state who support this package of water bills and to make a strong business case for the passage. As you've heard earlier, $2 a meter. Well, I'm here to tell you that when a utility doesn't collect bad debt, we're going to pass it into the rates next year, and you're going to pay more than $2 every year. There was a time in Detroit's history where rates increased by double digits for 2 decades. That's unsustainable, completely unsustainable. Secondly, there's a point I want to make that I hear in the hallways of every meeting that I go to when I talk about this issue, and that this is a money grab by the city of Detroit, and that the city of Detroit is going to be using the bulk of this money. Nothing could be further from the truth. Detroit has been running an income-based water affordability program for almost 2 years. There are 3 buckets of money that are needed to run the program and make it sustainable. The first bucket is the most expensive. It's to pay off the arrears. Detroit, by the time this program collects enough money, after these bills are passed, Detroit would have had its program up and running for 3 years. We've already paid off all of the arrears. I've spent more than $30 million paying off the arrears. That's the large bulk of the money needed for the program. The second bucket of money that's needed for the program is the gap payment between the $18 that's being charged, mostly in the city of Detroit, and the average bill, which is $80, which, by the way, is on the low to median end nationally for water bills. Washington, D.C. would love to have an $80. Theirs is almost twice that. And so that's the second bucket of money that's needed, and which we'll use most of this money for. And then there's plumbing issues. If you don't fix the plumbing issues, they're going to accrue more arrears, and the program won't be sustainable. However, there are other funding sources that come out of the federal government, the state, CDBG money for home improvement programs that can be utilized. And by the way, Detroit does kick in $5 million to our program now. So the fact that we're going to suck most of the money out of this program is just not true. Most municipal water utilities are funded solely by the revenues they collect through billing. They do not receive property tax revenue like other municipal departments. Each fiscal year, every water utility determines its revenue requirements to operate its system and fund infrastructure projects for the year, such as removal of lead service lines and preventing water loss in the distribution system. But utilities must also deal with budget challenges due to uncollected revenue, which prevents them from performing planned and emergency infrastructure maintenance, repair, and replacement projects. Collecting from every customer has a public health impact. When we collect full bill payments, we can optimally deliver clean water and collect and manage wastewater. When customers do not pay their bills, current state law allows utilities to collect delinquent debt by enforcing a statutory lien on property and sending it to foreclosure, or filing lawsuits against our customers, or shutting off the water. These remedies are strong incentives to pay if those customers have the ability to do so. These collection tools are not effective for households who do not have the ability to pay their entire bill. When all the other remedies fail, the only way to recover that uncollected revenue is to place it on the books as bad debt expense. Then raise rates accordingly the next year to recover the loss. Raising rates affects every customer and exacerbates the problem for low-income households. The circular process of passing debt into customers who cannot pay makes absolutely no sense. Based on experience with our DWSD Lifeline plan, if you give the low-income customer a bill they can afford, they will pay. They will contribute to the cost of operating the infrastructure needs. However, water utilities of all sizes around the state need a dedicated funding source to pay the rest of the bill to support the budget and deliver services. No utility can cover the cost of separate affordability programs through its local customer base. We need the legislation to establish a stable, reliable funding source as well as a centralized affordability program so water providers, large and small, can protect public health. As a nation, we do not expect the electric and gas utilities to forego upgrades to their system due to uncollected revenue. Those utilities have received a subsidy for years for their affordability programs through LIHEAP. This legislation will put Michigan on the map as the first state in the nation to understand access to water is as virtual as gas and electric service and should be deemed more vital as a public health requirement. I'm happy to answer any questions that you may have.
Thank you all very much. MBC Martin.
Thank you, Madam Chair. Yeah, to follow up from earlier, just so the customers that are actually paying at their meter an extra up to $3 on the meter, do we have an audit type breakdown so people actually know what's being paid for and the percentages of the money that the taxpayer is going to provide to somebody else and not their own water bill?
Not exactly sure. What we're trying to do is make sure that everybody is part of this process. There's a significant number of folks. Again, this will be separate from the water and sewer bills that we do. So anybody, even who's getting the subsidy, will still pay that $2. And when we're talking about the subsidies, once again, this is allowing the low-income ratepayers to pay about the same percentage of their income as average folks do. You know, most folks pay about less than 1% to maybe 2% of their income. This would make it so 2 or 3% of the income for the low-income folks that would allow them to actually pay that bill. As you know, I understand what folks are saying that you know everybody would pay into this and some people would benefit from it. But really, when the systems are have enough income to do the work they need to do, we mentioned true cost of service. If they're able to do that true cost of service, we have to make sure that they have that ratepayers being able to do that. So it seems to me that when we're having everybody put into this, any point when anybody can have a car accident that means you lose your job and you suddenly you don't have the income you would have had. So this is an ability for everybody to be covered by this in a way that still makes sure that we can do all that work that needs to be done. If we're not doing that work, the costs coming in the future to make up for what we hadn't done in the past is going to be much more expensive. So we have to have that money to invest. I'm not sure if I answered your question.
It doesn't even come, I'm sorry, I have to say it doesn't even come close. What I want to know, when I pay my property tax, I get a breakout, what the assessments are, what the specials are, administrative costs. When I pay anything, I get an audit that says, at the county has to audit, their books and so forth. Now I'm going to pay $3 more on my water. I don't know, when I get my water bill, I know what it's being paid for, the administrative costs, the distribution, the chemical costs. Everything's broken down. But now I'm going to have another up to $3 bill on my water bill. What is the breakdown of that $3? If I send it to the city of Detroit, how much percentage they get, what is their breakdown for what they pay? If I send it to the city of Flint, what's the breakdown that they're going to be paying? Where do the funds actually go that I'm funding with my $3 and all my residents are paying for $3 on their meter?
I'm going to let Kelsey answer that.
And then Debbie too. Let me take a shot at seeing if I can get the answer to your question. So the money is what we typically would charge for rates. Obviously, that's going to be more. So where you'll see the breakdown is at the local level. Each local municipality approves their rate schedule. And within that, you'll see exactly what percentage goes back to the water service provider, which percentage goes for water treatment to the treatment plant, what percentage is going for capital investment, for maintenance, for operations, and so forth. So the extra fee that everybody will pay on their bill will go to that total revenue captured, and then it will be distributed back out, transparency through the bill or the rate approval process at the local level.
Okay, that makes sense because I'm talking about infrastructure. I'm talking about the production of the water. Is there any pension in OPEB or salaries for administrative fees in that?
There is overhead that all utilities have, and so yes, there's cost allocations that go back out to every local community that we operate that it would include overhead for personnel costs.
Deborah Poss-Peach from the Detroit Water and Sewer Department. Representative Martin, built into this legislation is a breakdown. There will be annual reporting, what all municipalities contributed to the fund, how the monies were dispersed, what part was administrative costs. There is some legislation about a cap on how much is for plumbing repairs as a whole. So each municipality, each water provider will provide data to the state, and they will do a comprehensive report showing how that money was dispersed.
And Madam Chair, if I may, I'm asking these questions because there's so many things that we've done recently in the state to cover costs. We've spent money to raise everybody's pension plans up to a certain amount so that they don't go bankrupt. We seem to reward bad players over the ones that are well-funded. My city, our water fund is well-funded. I'm going to be paying $3 for somebody else's. So now the question is, to my residents and my constituents, what are they paying for? And is it audited enough to manage the money? If we're paying for somebody's if their water bills are outrageous, it's not just the water production, it's not just infrastructure, but if there's an underwater mortgage type pension plan, OPEB, that we have to bail that out to cover these water rates so they don't go broke, is there a breakdown of it is my question.
I think I understand your question better now. Is you're looking for about more accountability on the local level as far as how much they're charging for water in the first place. That is not part of this particular bill package. It's just setting up the stipend amount that will go towards the Water Affordability Fund.
And to follow up on that question, is there a breakdown on water bills now about how much of your rate is going to cover any of those overhead costs?
For ours, it's not directly on the water bill, so you'll see the fixed charges, the variable charges for both water and sewer, and any other detailed line items. But we do annual rate presentations to all of our communities that are public meetings where we break down everything.
Great, thank you. Do we have additional questions from members? Rep. Shriver.
Thank you. I've heard, obviously, there's been a lot of testimony, and this is probably the longest committee hearing we've had so far. I'm not complaining, please. I'm not complaining. I'm just setting the stage because the question that I've had, I don't know if you remember way back in the beginning, I had this question, and I've held it until now, and I was waiting to see if it was answered, and it wasn't. So that's why I'm saying that. I'm not complaining. The question that I have is, what is the average water bill per month across Michigan? Do you guys know that information?
I know the city of Detroit is $80 is the average water bill for our customers.
Wow.
The way water bills are decided is you take how much water you use, how much services you use from the supplier, which is, in our case, Great Lakes Water Authority. And then you have to add in all the costs of the community itself, whether they have internal infrastructure projects they're working on. All the operations and maintenance is usually done by the local community itself. Everything is done within that, and again, we're audited. We're everything is done in a way that's open to the public. We have significant laws that make sure that what we do is correct. These are all enterprise systems. We don't make a profit. There's no profit in this. These are specifically used. It's a fee, so it can only be used for the enterprise that it's a fee for. We can't take it out and use it for, police or anything else that aren't related to the actual water bills. So everything is very, very tightly regulated and it has to add up, and it has to be something that works, again, making sure that we're paying the true cost of service.
So I've done a little bit of digging here, and it's a very simple number. It's crunched for every state. It's $29 per month, basically $1 a day.
$29 a month is, I don't know of any.
You're talking about water.
Yes, I'm talking about water.
Sewer, stormwater management, and each municipality can charge differently for each category. You may be charged on your property taxes for if you have a combined system and you have waste drainage. We charge an impervious. So it's difficult to have apples to apples by cities, depending on how they're charging and collecting revenue.
Right, but as a state, like the decisions that we make here are for all Michiganders, and so we're looking at this at a state level. And I mean, you have some variance. West Virginia, their average statewide water bill is $91. Ours is, as I said, $29 across the whole state. And so I'm looking at this, and I get that the rate has doubled since 1980, but you have to mention the fact that the value of $1 has decreased 3 times since 1980. So
Representative, that figure was adjusted for inflation, so the value of the dollar doesn't matter in your argument. If you're going to talk about an average, then you need to take into account everything. Is your water bill $29? Okay. I'm going to assume, is that a yes or a no?
I'm directing my question.
I know, but I have one for you.
Okay.
Mine is not.
Okay.
Mine is higher than 29. Is
Yes.
yours higher than 29?
That's not relevant.
It is, because that's the whole point of averages. They're significantly higher in some areas, significantly lower in others. So please move on from this line of questioning, or make it relevant, please.
Okay. Just so you guys know, I'm genuinely trying to understand the average for all Michigan residents and communicate that, because it's important for us to make decisions in lieu of every single Michigan resident. The other point that I wanted to make is, or question I guess I have, is do you do any analysis on the amount of waste that goes into a given situation where someone's unable to pay for their water?
I'm not sure what you mean by waste.
Wasteful spending.
Wasteful spending on the part of the utilities?
No, on the behalf of consumers.
Oh my gosh,
Yes, and inflation today is it's relative, but it was around 7.6%, or in that range, where our rates have only increased 2.5 on average the last 10 years. And so that's an indicator that the system is being run efficiently. We have a AA bond rating that we enjoy. We're operating as efficiently as DWSD has ever operated in its history. So is there waste? Yes, there's waste because the system is leaking water. The infrastructure is 120 years old. There's been decades all over the country, not just Detroit, all over the state of Michigan. There's been decades of deferred maintenance because the dollars weren't available to do that. So is every water system leaking? Yes. And until you can make those repairs, my point is if you don't have the dollars and you're not financially healthy, you're not able to do those programs and correct that issue of water leakage.
And I'm in complete agreement regarding our crumbling infrastructure. New Jersey had a very similar problem to Flint. It's been 6 years. New Jersey's good. What's going on with Flint? And so there are some very necessary infrastructure issues that need to be addressed. My question is more so about the consumer and looking into just overall trends, because we're talking about 10 million Michigan residents here. We're not talking about my personal finances or anyone else's specific situation. We're making this decision for all of Michigan. So on average, there's plenty of studies that go into just for example, consumers spending an average of $133 more each month on subscriptions than they realize. And that's going into your mobile phone, your internet, your streaming, your Amazon Prime, your gaming, your news, etc.
Rep. Shriver, that's just about enough. That has no relevance to the legislation before us.
How is that not relevant?
Because we're talking about people who can't afford water. I don't think they're being wasteful on Netflix. Move on.
I'm asking if we can prove that.
Clearly, you have never had to worry about your water being shut off. I have. I have had to go to Panera to use the restroom because we couldn't use the toilet. I didn't have a place to shower, so I had to use friends' homes. And I'm only bringing that up because I apologize to every person who was impacted and came here and then had to be subjected to this. It's insulting and it is improper. We are moving on. Minority Vice Chair Martin, I believe you have a follow-up.
I do. One of the reasons I was asking this question, and I don't want to put the city of Flint on trial. Actually, they've already come through all that. And but I do want to mention out the start of the whole problem was they were paying 7% for their water rates, and because the city of Flint was then using the water fund to pay their general fund because they're upside down in their pension plans and so forth. So my question is, I'm being taxed up to $3. It's not a fee. I don't get anything back for that. It's not like I'm getting water from these different municipalities. So I have to pay $3 on my water meter. Every one of my residents will probably have to pay that much. So I just want to make sure that the municipalities are held accountable, that if we're going to bail them out, that they have well-managed plans so the $3 goes to taking care of somebody's water and not taking care of somebody's city's pension plans and administrative costs. That's my whole point of asking those questions.
I can tell you for the systems that we operate and maintain through the Great Lakes Water Authority, Water and Sewer Services, they're paying this funding to, again, some of it is for older infrastructure. A lot of communities, Pontiac the cost to replace the lead lines is going to be about $65 million. This is something that's just going to be starting soon, and all these things are going to increase your rates. If you have a stable income stream that many communities do not have now, this would provide that. You'll be able to do much more of that work year after year, and you won't have to do those increases in rates as much as you would have done otherwise. We all have retirement schemes. We all have employees that need to be paid. That overhead is part of any system you're going to do anywhere, of whether it's water or not. And this will allow that system to operate in a much more steady stream of income than it is now. And this will allow those folks to do that. Again, like I said, this is an enterprise. It can't be spent on anything else legally. And it has to be done in a way that's going to be a sustainable, long-term process. Most communities are working that already, even the ones that are low income, that are very small, that, like I said, have a hard time affording just the copay into a grant. This is going to allow them to get more of that income, to keep those rates year after year from going up as much as they are now. That's what we want to do in the long term. It's going to benefit everybody in the system. If you're paying $2 more now, and then over the next 10 years, you'll be paying $10 less a month because of that work that's been done in the meantime, that's going to affect your rate in a positive way. So this is how we need to be doing it in the long term.
Did that answer your follow-up, or is there further needed?
No, I just want to make clear that, if somebody kept, their employees on the payroll for a long time, when they should have been adjusting the size of their cities and their departments, I don't want my residents to have to be bailing that out because of poor management. Not that you have fees, we understand that, but if I know that there is way too many employees per citizen in a lot of these municipalities, and I don't want to pick up the slack on that when to take care of the people that need the help with the water in their home.
Thank you very much. Okay, do we have any other questions? Rep. Pies, if you can be quick.
Thank you, Madam Chair. I don't know if this is so much a question as I understand people's concern about paying an extra several dollars per month. I would offer another alternative, that this is an investment in your community. When you keep people in your homes, you take care of blight. When you take care of blight, you make your homes and your neighborhoods more valuable. You encourage home ownership. You encourage people to move to your city and to be more responsible citizens and a more responsible community that can help alleviate at least part of this problem somewhere down the road. So I appreciate your perspective. I'm just throwing another one out there for a broader audience. Thank you.
Madam Chair, can I just one quick point? These water pipes have no boundaries. And when Detroit has the water treatment plant, and it also has the wastewater treatment plant. So we take the water out of the river, we clean it, and we send it all the way to Flint. And then when they use it, they send it back. And when the pipes are not functioning, or the pumping stations or the treatment plants, it may not be in your city, but it's going to affect your city if it starts to back up. So I really want to think of this as one water. It's one system. And if you look at it as an individual system, if Jim is looking at just what's happening in his city, the system is dysfunctional. So it's one water.
Thank you all very much. Moving along, next up we have Reverend Edward Pinkney from the Benton Harbor Community Water Council, testifying in support. Is the Reverend here? Okay. Moving along then, testifying in support, we have Nicole Hill, who is an impacted resident from the People's Water Board Coalition. Nicole, are you still here? Or is she on Zoom? No. All right. Thank you very much. Next up, we have a representative from Mothering Justice, Nikenge Browner, the Grassroots Program Director. She is testifying on Zoom, I believe.
Yes. Hi, everybody. Can you hear me?
Yes, we can. Thank you so much.
Good morning. Okay, so I'll try to be brief. I just had the opportunity to address you today. I'm Nikenge Browner. I'm a lifelong Detroit resident and deputy director at Mothering Justice, and also somebody who grew up in a house who often did not have water. During my childhood, my mother had to choose between rent, food, and utilities were often a luxury. This led to me struggling to complete school, either not wanting to go to school because of hygiene issues or worried about students noticing that uniforms had not been washed. My story is not unique. As I continued my work with Black and Brown mothers in the city, I realized there are so many similar experiences. And so I do policy work with Mother and Justice, and I've been in the homes of a lot of Black and Brown mamas in the city. And what I noticed that while a lot of children get to associate bath time with warm bubbles, bath toys, things like that, there are entire communities of children who associate bath time with Nestle water bottles and being rinsed off in worse conditions than my pet spa. In Michigan, countless mothers are grappling with challenges stemming from unaffordable water bills. The bills lead to shutoffs, hardships, financial strain, and things like that. But the issue that we've been helping moms with, and that is so important to me to join this fight and really care about which bills are getting passed, is because it's also causing mamas to have to interact with Child Protective Services. For these reasons, we should ensure protections for impoverished families. We genuinely appreciate State Senator Stephanie Chang's dedicated efforts to tackle unaffordable water rates through the Low Income Water Assistance Program. However, we truly support the most vulnerable, and we urge that House Bill 5088 be amended. Specifically, we propose separating the program's funding source from the benefits it provides. By doing so, residents can continue to afford their water bills while funding concerns are being addressed. In the city of Detroit alone, approximately 60,000 households are struggling to pay water bills, with a staggering 78% of these households led by single mamas. We cannot turn a blind eye to the constant fear that mothers live with, the fear of Child Protective Services intervening due to water-related hardships. Therefore, we request that House Bill 5088 be amended to ensure that even in cases where there might be insufficient funding to provide a discounted water bill, customers are still protected from unaffordable bills. In doing so, we can make a significant positive impact on the lives of fellow residents, and by extension, build on a more equitable and compassionate Michigan for all. Thank you for listening to my testimony.
Thank you. Does anyone have any questions for Nakenge? Thank you so much for taking the time to be here. Next up, also testifying virtually, we have Christy Meyer, who is the campaign director for the Water Equals Life Coalition.
Hi, good afternoon. Thank you so much, Chair Pohotsky, my Majority Vice Chair Hill, Minority Vice Chair Martin, and members of the committee. Really thank you for the opportunity to testify as a neutral party today. My name is Christy Meyer. I'm the campaign director for the Water Equals Life Coalition. And I would like to start off by thanking Senator Chang and the work group for all the efforts to create a package of bills to support low-income customers to pay their water bills. We believe these bills provide some good provisions and will provide short-term support for those facing financial hardships. But more needs to be done to ensure all low-income residents are able to pay their water bills. House Bill 5088 would create the Low-Income Residential Water Program, which we heard earlier, and discounts water bills based on the average household income within 2 federal poverty level tiers, which is outlined in my written testimony, which I hope you have before you. And this is briefer. And that Representative Ayash spoke about. Customers within those tiers will have their bill discounted to 2% and 3% respectively, while those customers that are in the middle or in the top of those tiers will be able to afford their water bill. It is those customers at the low end of those tiers that will be paying far more than 2 or 3% of their household income and will be forced to choose between paying their water bill or other necessities such as food, medicine, and other critical bills. Once a customer cannot pay their water bill, they can face water shutoffs, arrears forgiveness goes away, and families can spiral downwards financially. In addition, the water legislative package requires customers to pay a $2 fee per water meter, which we've all heard about, and which would then go into a water fund created through House Bill 5089. This fund would be available for water utilities to draw down money to provide the 2 or 3% cap to low-income customers enrolled in the program. Once the funding has been all used up, the cap of 2 or 3% local utilities have been providing low-income customers in the program could increase to a cap above 3%, making those customers who could afford their discounted bill potentially unable to pay their water bill anymore. Once that happens, the other protections provided, arrears forgiveness and protections from water shutoffs, also disappear. While House Bills 5088, 5090, and 5091 will support families and customers with temporary financial windfalls, these bills simply do not go far enough to protect the most vulnerable from shouldering a heavy burden of rising water rates. Therefore, the Well Coalition, at the minimum, respectfully requests House Bill 590, the Water Shutoff Protection Bill, be amended to ensure if there is insufficient funding to provide a discounted water bill, customers with an active application or enrolled in the program are still protected from having their water shut off or having their arrears certified to property tax if they continue to make a good faith effort and are paying a regular, affordable amount toward their water bill. Thank you for the opportunity to testify before you today. I'm happy to answer any questions.
Are there any questions for Christy? Thank you very much for being here, Christy.
Thank you.
Next up, we have also testifying via Zoom, Gwen Howard of Redeem Detroit. Gwen, are you still with us?
Good afternoon.
There you are.
Good
Hi.
afternoon.
Good afternoon. The floor is yours.
Thank you so much. Chair Potowski, Majority Vice Chair Hill, and Minority Vice Chair Martin. I am deeply appreciative of the chance to address you today. My name is Gwendolyn Y. Howard, and I'm proud to call Metro Detroit my home. Over the 3 decades, I served as a worker in various departments of the Department of Human Services in Detroit. My mission was to ensure that every customer that we serviced in our city had access to essential services required for a healthy and fulfilling life. I took great pride in my work, which naturally led me to become a lifelong advocate for our community. As we know, water is the most fundamental necessity for human survival. It should be clean, safe, and affordable for every individual, regardless of economic circumstances. I commend Senator Chang for her efforts in proposing a bill package to aid low-income residents struggling with water affordability. However, I stand before you today to voice my concerns for those who might still fall through the cracks. I'm here to employ you to consider necessary adjustments to House Bill 5800. If there's insufficient funding to provide discounted water bills, it's crucial that we ensure customers are shielded from water shutoffs or certification of their arrears to property taxes, as long as they are genuinely making an effort and paying a reasonable, affordable amount towards their water bill. We find ourselves at a unique juncture in our state's history. With the chance to set a national precedent on water affordability, the time is now to make the pivotal change that will guarantee every Michigander has ongoing access to clean, safe, and affordable water. Let us not let this opportunity slip through our fingers. Thank you for your time and your thoughtful consideration.
Thank you very much. Does anyone have any questions for Gwen? All right. Thank you so much, Gwen. I appreciate it. Next up, joining us via Zoom is Benton Harbor Commissioner Mary Alice Adams. Hi there.
Good afternoon.
Hi. Before we get
everyone.
started, I just want to make sure that we're reflecting everything accurately for the minutes. Are you testifying on or in your role as a Benton Harbor Commissioner, or I know you're also affiliated with Community Action Agency, so I just wanted to make sure I was being clear about who you were testifying on behalf of.
Well, actually, as a commissioner.
Fantastic. Thank
As
you
an
so
elected
much.
official.
Then, Commissioner, the floor is yours.
With an honor to be tasked to improve the quality of life for my constituents of the great city of Benton Harbor, and I just want to thank you all for your time and your consideration at moving some type of legislation forward. You know, to improve the quality of life for people that entrust in you, these are tasks that they can be kind of hard in decision making, but I can assure you that it's not because they're watering their grass. You know, I grew up in Benton Harbor. I'm a lifelong resident, with the exception of a couple of years moving looking for something instead of seeking what I was looking for in my own backyard. I've noticed that the bills in Benton Harbor, being back here now for at least 23, 24 years, have actually doubled. And I've been an elected official for 3 terms. And I know how the system works, because when we need infrastructural things done, it's the residents that have to incur the cost. We have, the wants of splash pads and all of this for the children and stuff. But we used to, as a child growing up in Benton Harbor, we had timers that used to come on and actually water the grass to keep the grass clean, and green. But since then, we've had so many troubles infrastructurally trying to find dollars to ensure that the citizens were being serviced drinking water and sewer. And we already know that we are living on over 100-year-old infrastructural system throughout this country. But I'm gonna just stay with Michigan, because the poorest of the poor should not have to bear the cost. And I'm just not talking about a predominantly Black community, because poor does not have a color, and it's affecting a whole lot of people. I've experienced just recently, earlier this year, in my own personal life, undergoing after being diagnosed for cancer and having to endure oxygen, another thing that we can't live without. And I heard somebody speak on that earlier, but I won't stay with that. I'm just asking that we don't traumatize and punish the least of us with higher water rates. We need to go one step further to make sure that, they're not falling through the cracks. And I would just first like to ask that, the first 18 months may seem like a quick timeline to implement a new program, but that in itself entirely, when you're in fear of losing your water and falling further and further behind in debt, it's hard to catch up, and to not have something, some type of safeguard in place to help the least of these. And I didn't realize that I would become one, after enduring, cancer treatment and living on oxygen. I'm hoping temporarily, but it could happen to any of us at any given time, because the things we eat and the way we treat,
Commissioner,
ourselves.
I'm sorry to have to cut you off, but we are kind of coming up against a hard deadline, and I want to make
Yes,
sure that we
ma'am.
can get
Yes,
to the
ma'am.
others. But I
would
do
just
appreciate your
wanna thank
testimony.
you all for your time and consideration.
Thank you very much for being with us and for sharing your testimony. Thank you. Next, testifying virtually, we have Ann Bowman who is the Deputy Director of Freshwater Future.
Hello, can you hear me all right?
We can. The floor is yours. Thank you, Ann.
Great, thank you very much. Good afternoon, Chair Pohutsky, Majority Vice Chair Hill, and Minority Vice Chair Martin. I'd like to thank you for the opportunity to provide testimony today. My name is Ann Bauman. I work for Freshwater Future, and I've lived in rural northern Michigan in Sheboygan County for more than 33 years, always working on water issues. Freshwater Future is a Michigan-based nonprofit. We're a catalyst for community action that strengthens policies designed to safeguard the waters of the Great Lakes region. We work with thousands of organizations in Michigan, as well as in all the other states, and tens of thousands of individuals to protect water from source to tap. We thank Senator Chang for her efforts to create a package of bills to support low-income customers to pay their water bills. We believe this package will support many Michiganders struggling to pay their water bills, and it is a good first step towards creating a water affordability program. I want to share my experiences with low-income people in northern Michigan having difficulty affording their water and even losing their homes due to past due water charges. In the city of Sheboygan, as has been discussed from other speakers, I became aware a few years ago that past due water bills were being referred to the county to be added to their tax rolls, and that if people were then unable to pay those tax bills, their houses would be lost in tax auctions. It's just unfortunate. My son also went to the very rural and low-income school district of Pellston, where PFAS was found in recent years. That PFAS contaminated private wells in the village. They do not have a municipal system. So to reduce exposure, now point-of-use filters had to be installed in every home in the village so that that's at their sinks, and it's needed to make sure that they have safe drinking water. Residents also face the potential there of a future monthly water bill if it's deemed necessary to install a municipal system. In rural communities, residents are being confronted not with rising water bills, but due to backlogs of maintenance of the systems while their incomes are not rising. This week alone, Sheboygan had 9 water main breaks, and the estimate to repair it is astronomical. And they do not have the employment that some of the other communities do in northern Michigan. In addition, many of these communities, like Pellston, are also dealing with toxins in their water, causing increased costs to secure safe water. And another example is the village of Mansalona that had to install a water system after TCE contaminated the wells in that community. My neighbors and others across the state need to have access to water bills that match their incomes without making them choose between water and other necessities like food, medication, heat. I'm neutral to the current bill, as I do think it takes a step forward in providing an assistance program for low-income families, but I also know these families need more. Like bills that are 3% or less than their household income, without the risk of suddenly having those bills raised if program funding runs out. Freshwater Future respectfully requests at a minimum that House Bill 5090, the Water Shutoff Protection Bill, be amended to ensure if there is insufficient funding to provide a discounted water bill, customers with an active application or enrolled in the program are still protected from having their water shut off or having their
I'm sorry to
certified.
Anne, I'm sorry to cut you off. I do appreciate your suggestions, but we are running out of time, and as others have testified to that proposed amendment, we have it. So we have taken note. So thank you very much for joining us. Next up, we have Reverend Paul Perez, who is testifying via Zoom.
Thank you, Representative. I'm Reverend Paul Perez. I'm a resident of Livonia, Michigan, and I serve as minister of Central United Methodist Church in Detroit. I speak in support of these bills. I want to speak as a person of faith in my Christian tradition. In our tradition, water is a good gift from God that is meant to be shared with all people and living creatures. And United Methodists believe that access to clean and affordable water is a human right. Water, therefore, for us has a spiritual and material dimension. Spiritually, our United Methodist communities use water to welcome people into our churches and as a symbol of God's abundant love and grace through the ritual of baptism. So access to clean water is important for us spiritually. And then materially, United Methodists in the state of Michigan have about 700 congregations in about every county across the state, Upper and Lower Peninsula, where in rural, suburban, and urban communities, our churches are often at the front lines of providing basic necessary care, food, water, clothing, shelter for people in rural, suburban, and urban communities. I know from my experience of talking with leaders across the state that all of those communities have people who struggle with their water bills and struggle for clean and accessible water. United Methodists were at the forefront of providing, helping to organize to provide water in Flint. We've also been at the forefront of long-term disaster recovery and disaster case management in communities whose infrastructures were overwhelmed by historic rainfall. So in Midland and Detroit and Houghton Hancock. So we know the cost and the consequence of a water system that's not affordable and for whom there is deferred maintenance in the infrastructure. And so because of these two things, spiritual and material, I really encourage you to pass this legislation. Thank you.
Thank you very much, Reverend, for your testimony. Does anyone have any questions? Rep. Shriver?
Is he still there?
That's a great question. Yes, he is. Reverend, we do have one question for you if you can tune back in.
Sure.
Hi. Thank you for coming. My question, just because you brought in your reasoning as a Christian, I'm a Christian myself, and 2 Corinthians 9:7 says, each of you should give what you have decided in your heart to give, not reluctantly or under compulsion, for God loves a cheerful giver. How would you reason to forcing Michigan taxpayers to give under compulsion in order to accomplish this policy?
Yeah, I think I would balance that scripture with other parts of the scripture that call for human communities to care for the most vulnerable among them, the widow, the orphan, and the foreigner, and scriptures across the Old and the New Testament that really talk about people who are thirsty having something to drink. So I think as a person of faith, we have to balance both the individual and the communal. So I don't see this as a coercive or compulsion for Michigan residents. Instead, I see it as an opportunity to act in our responsibility, the residents' responsibility as part of a state, as part of their communities, as both residents and responsible members who can join together for the common good and help to make sure that all of our communities are safe, that there is provision for public health, and that no one can go thirsty. So instead of a compulsive act, I see it as an invitation to be a cheerful giver.
Amen to that. Thank you, Reverend. Moving on, we have Mary Ellen Howard, who is a People's Water Board Commissioner. The floor is yours. You're muted right now, Mary Ellen. If you could unmute. You're muted on Zoom. If you could hit the unmute button so we can hear you. No, not yet. There we go. Brilliant. Thank you.
I'm sorry. I'm Mary Ellen Howard, a retired public health nurse and a Sister of Mercy. I belong to a community of 2,000 Catholic sisters across the United States who support the human right to safe, affordable water. For 20 years, I ran a free primary care medical clinic serving uninsured adults. Many of our clients were between ages 50 and 65, and they worked in part-time minimum wage jobs with no benefits. They lived below the federal poverty level, many of them. I became aware of the problem of water shutoffs when our patients would come to me and tell me that they could not afford to pay their escalating water bills, so their water had been shut off. These patients had a variety of health issues: diabetes, cancer, disabilities, COPD, open wounds that wouldn't heal, and dehydration. They needed access to clean, affordable water, or the care that we provided at the clinic would be futile. I wrote letters to area water utilities pleading to have the patient's water turned on and laying out the consequences to the patient's health if they didn't turn the water on. In 2014, 50,000 households were shut off in Detroit, regardless of who lived there: babies, children, the elderly, pregnant women, and those who are sick. When I retired in 2014, I joined the People's Water Board, a grassroots movement addressing primarily the affordability of water, as it was clear to us that poverty was the root cause of the shutoff problem. We need a long-term solution with an ongoing source of funding. Water assistance programs are not the answer. They might get the water turned back on this month, but when next month's bill arrives, it's still unaffordable. and soon the water will be shut off again. In 2023, with House Bills 5088 and to 5093, we have an opportunity to fix the current unjust, unhealthy situation for the citizens of Michigan. These bills mean that local water utilities will not have the moral burden of causing severe stress and harm to the public health of their customers. These bills will maintain the flow of water and the dignity of Michiganders. We ask you to pass these 6 bills into law for the good of the citizens of Michigan. Thank you.
Thank you very much, Mary Ellen. Last and certainly not least, we have Teresa Landrum, who is testifying via Zoom.
Good afternoon.
Hi, thank you, Teresa.
Chair.
We are going to have to cut you off at 3 minutes. We do have a hard stop, so by all means, please start, but we are going to have a 3-minute limit.
Thank you for that. Good afternoon, Chair Pahulski. Thank you so much for this opportunity to speak before you today. As mentioned, my name is Teresa Landrum. I'm an environmental justice advocate and founding member of the 48217 Community Environmental Health Organization located in Southwest Detroit. I am also the current president of the original United Citizens of Southwest Detroit. You may have heard about my community, and if not, I'll give you a little background. For decades, I have been advocating for clean air as well as clean water. My community is notorious for its title being deemed the most polluted zip code in the state of Michigan. What you might not know about my area is that we're paying upwards to a quarter of our income for water and sewage bills. Over the past several decades, water rates have risen at a higher rate than any other utility, and my community has seen the impact. Michigan residents are bearing the brunt of the burden of federal and state divestment in water, the failing infrastructure, and contamination remediation. All of these factors have led to our current dire predicament in which residents are paying a significant portion of their income on maintaining the water services. For that reason, I am grateful to Senator Chang for advocating for low-income residents and proposing this package of bills. I believe this package is a step in the right direction for water affordability for my community and for all low-income folks in Michiganders. I'm happy to see things within the bill that will benefit my neighbors, including financial assistance towards drinking water, stormwater, and sewage treatment. However, before voting this package of bills out of committee, I would like to propose a few amendments to strengthen it. To start, it's important that the legislation is separated from the funding source for the program. We face a challenge because the funding is tied into the bill, but it's not guaranteed. If it's not guaranteed, then we need to find a source outside the bill to make sure that the funding is a permanent solution for water affordability. Next, adequate shutoff preventions and protections need to be included within this legislation. I heard it mentioned that they will be a resident will be notified 4 times. Well, we have a lot of residents homebound that are bedridden, and they have caregivers coming in who are not handling their bills. And we also have people with dementia. They get the mail, they read it, they don't remember the bills. That we need extra protections to prevent their water from being shut off. Also, I believe it's important to expand this water affordability plan to renters. Many of the people in my community that are renters now often cannot get the bills in their name. They have the absentee landlord, and the water is being shut off on them. I support the legislation, and it must include a process for forgiving past debt and arrearages. I have seen firsthand the high arrearages that have occurred for some of my neighbors, and can tell you that without a debt forgiveness piece, countless residents will suffer. I urge this committee to approve the amendments I have detailed. Clean air, clean water, and affordable water are all basic needs. I ask that we work together, pass an equitable water affordability program for Michiganders, because we understand that the 3-tiered program, that is the Lifeline program, the funding could run out, and some of the people will still be struggling afterwards. So we need permanency. We don't need things to be funded on a temporary basis. And
Thank
so
you
with
very
that, I
much,
thank you for
Teresa.
allowing me to
We're
speak.
at about 4 minutes now, so thank you very much. I appreciate your testimony and your suggestions. Thank you. We have a number of cards for the entire package that will just be entered into the record, but there are a handful on 5091 that I just wanted to read since there's only a couple. Again, he would have spoken but was not able to, but opposing the bill is Brad Ward from the Michigan Realtors Association. Not wishing to speak opposing is Amanda Fish from NFIB. Not wishing to speak opposing is Forrest Wall of the Apartment Association of Michigan. And not wishing to speak but opposing the bill is Erica Farley of the Rental Property Owners Association of Michigan. Other cards on the entire package will be entered into the record. Seeing or having no absent members today and there being no further business before the committee will stand adjourned. Thank you.